We do an open session here. I don't know if we're going to do that tonight, since I think, and I say open session, what I'm talking about is where we open it up for anybody that's got anything outside of what's on the agenda or something. So in turn, we're just going to start into the pledge and start our meeting. So you'll stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I guess I will ask real quick, is there somebody that's got something outside of what's on the agenda? I didn't think so. So anyway, Thrive Field Stuckey, what's going on here?
Hey, how are you all?
I'm doing good. How are you?
I'm doing well. I didn't know this many people were going to come to hear me talk about Thrive, but I'm really appreciative of it. Nice to meet you. I'm Phil Stuckey, the Executive Director of Thrive. Randy, and Mike, and John, okay? If y'all don't mind, I just kind of want to give you a little conversation about what we're doing at Thrive. Thrive is a recovery community organization. We're based out of Scott County. We're a 501c3 nonprofit. Just kind of give you all some information if you want to read it. John, come over there. Thank you. And then I got some pamphlets kind of tell you what we do as well. There's these.
So where are you located at?
We're located in the basement. Our rec center is located in the basement of the First Presbyterian Church.
Okay.
Can I sit down? Is that okay?
Yeah, you sure can. I prefer.
Okay, I'm gonna be up here for a while, guys. I appreciate y'all. No, so just kind of let y'all know what we do. Like I said, we're a recovery community organization, and 51% of our board are actually people in long-term recovery. We have allies and advocates are a part of our board as well, and what they do is just people in the community, and we're not talking about just substance use disorder, we're talking about mental health, families and friends that are involved with people that are in active addiction or in recovery. We have a very variety of members of our board. We have a chief of Austin PD is on our board, Lori Crosdale, Amanda Hurt from Community Corrections, and then a lot of people, like I said, in long-term recovery that are there as well.
Okay.
Some of the things, just to let you know, that we are doing, we on that first page you have there is kind of our mission and our vision of our recovery community organization. But on the back page, I kind of just broke down some of the programs that we do. Some of I need to say this because I forget every time I have conversations, is our services are 100% free. We don't charge any insurance company. You don't get a copay. You don't have to pay for anything that we do.
So how are you supported then?
So a lot of our support comes from donations that we do. Most of our people are voluntary basis. So we also have we partnered up with DMHA, MH, Mental Health America Indiana, and FSSA. If you ask me to break those initialisms down, I probably can't, Mike, to be honest with you. But they mean important stuff. But
That's why they're so long.
Yeah. But what they've done is actually, when COVID happened, the recovery community and the state got together and they really said, what can we do to help keep people engaged, right? And especially people even that are looking for services. And what they've done is they took the state of Indiana, all 92 counties, they broke it up into like 5 quadrants. And Thrive actually oversees 21 counties throughout the state of Indiana. When I say that, we have a satellite hub that we use. It's called the Regional Recovery Hub program. We have a satellite hub that we use, and they're located in Decatur County, and they kind of help us out with our part of there. We cover everything from kind of Union down to Clark, and then all the way to the border of Decatur, and then all the way to the other side of Washington Brown. Okay, so we pretty much focus on the 9 counties that are kind of right down that 65 corridor. Some of the things that we do, we have partnered up with some providers. We do MAT induction to help fill in those gaps. So say a Friday night somebody overdoses, right, and they go and they get Narcan and they tell the first responder that they want help, right? Well, our first responders are very good, busy people, and we know that. And so what we do is we have a thing called the overdose response team, where we've partnered up with all 3 local law enforcement agencies. I talked to Shannon, and we're going to do a little conversation in June to get with EMS. And so that if someone says they want help, they'll call us and we'll send somebody out immediately, whether it's 2 a.m., 3 a.m., and they'll work with that person to try and get them into inpatient, if it is outpatient, whatever it looks like. Our MAT induction, if somebody does want to go to inpatient, we all know with COVID numbers, they look a little bit different. We used to be able to get you in the same day. Now we're about 3 to 5 days out. But we can get you on some medication until you get into inpatient treatment.
So what's the, as far as inpatient treatment, is there open beds for that or open slots for that?
I'm glad you asked, Mike.
Because usually they're not.
Oh, sorry. Yeah, so a lot of places aren't. We do have, we do work very well with, so there's 7 local inpatient facilities that we have in our region, okay? And we have recovery coaches that work very closely with them. Not all of them do 24-hour admissions, but throughout the state, there is. So if we need a 24-hour admission and it needs to go up in Indy, we'll call our people up in Marion County, get that stuff going, and we will actually do the transport and get people up there.
Phil,
Yep.
what particularly brought you to Scott County?
What brought me to Scott?
The organization, not you.
The organization.
Yes,
So
right.
this started out of actually the Get Healthy Scott County,
Okay.
and they did some meetings, and CEASE was born out of that and everything, and they really identified a problem in Scott County, which I'm sure everyone knows about in 2015, right? And I think there's a few people who are going to talk about that.
No, they're here for something.
They're here for Thrive. Okay, I didn't know if they were here for the optic cable that Andrew's going to talk about or not. But what really started is they noticed that there was a need in Scott County, and that need was people in active addiction and people in long-term recovery. And out of that was kind of born Thrive. Because they really focused, and believe it or not, you have a lot of people in Scott County that are in long-term recovery that are working in other areas. And they identify that problem, and that's how Thrive was
Is
born.
it fair to say that it's not just Austin you're talking about? We're talking about all of
I will
Scott County.
guarantee you that it's not just Austin I'm talking
Oh,
about.
okay.
Scottsburg is, we have a lot of clients, and I actually broke that down for you in some numbers that we have.
Yeah, we have a new place now, Wampanoag, called the Refuge. Will
Mm-hmm.
you guys be able to integrate into that? I mean, have you had discussions with anybody about that yet?
No, we have not yet.
Okay, well, it's a local thing.
Yeah.
Should open, I don't know, sometime this year, I hope.
Yeah, we would love to. One thing that we've done is we partner with and collaborate with a lot of people. Kind of to go on where we got here is not only the inpatient that we help out, outpatient services, because some people are stable enough, they just need outpatient help. And like I said, we have about 15 recovery coaches. 8 of the recovery coaches, I'm a proud papa when I say this, are from Scott County, that were in active addiction in Scott County, but now are giving back to the community, and they're volunteering their services, and some of the funding that comes from the SOR money from the state is being able to pay to help them out too.
Was it Thrive that did the sweep we did last Saturday up in Austin?
We were a part of it, yeah, and that's one thing we do is every month, members of our organization are also involved in some of the clean up the streets,
Yeah.
where they go through and pick up trash, debris, anything that's out. Another thing that we do with our coaches is we're community based, right? And so what that means for us and what that means for the state is that we're not on one entity. We're not in the silo of, and I'm not going to throw any names out there, but if one SUD entity is here, they want you to come to their facility, right? Our coaches actually come to you and
Talking
say,
about like a Salvation Army.
Salvation Army, a Centerstone, a Life Spring, something like that. They're all great places,
Yeah.
but our coaches can walk in and say, here's all your options. What best fits your need and your journey, right? Because I'll be honest with you, and as hard as this is to understand, the people that really know what's going to work for them are the people that are going to be receiving the services. It's real easy for me, and I have credentials and everything as a counselor, and it's real easy for me to be able to say, you need to go to inpatient for 30 days, then you're going 12 months into a long-term place. But really, it's what's going to work for that person. And so that's how we're holistic in that way. Another thing that we do is we've partnered up and we're having conversations and with Scott County. We work very closely with Sheriff Gooden, where Lindsay, one of our recovery coaches, if someone is incarcerated, she will meet with them to help them on their reentry piece when they get released. Because as we know, as a COVID as well, there was a lot of early releases and a lot of people weren't ready, right? They walked down the street and the only thing they knew was to call the same old people they always called. So we're working with them. We also are working with Harrison County on a reentry program, where if it's 90 days or less, we'll actually go in there and help if it's housing, transportation, a
You're talking about
provider,
incarcerated.
people,
Okay.
correct. Because I believe it's around, and statistics always change, right? But I believe it's around 85%, likely more to overdose after incarceration when they first get out, right? Because they're gonna go back to what they know and their tolerance is no longer the same, right?
Yeah.
We're also involved in problem-solving courts. We have recovery coaches that sit on the treatment team. One of them is in Clark County, and then we have one that's up in Bartholomew County. So, and I want to say it again, these are all 100% free services. I do want to give y'all just some numbers real quick.
I want to ask a question. Though.
Yeah.
You're saying that if your service is free, but if you get them into a rehab or a recovery center, that is not correct.
Correct. Now,
Your upfront is free.
very, yes.
And once you assign them or they get in, accepted into one of these programs, then they have to pay or
Yeah, and
insurance or
well,
whatever.
and I'll even speak on that a little bit because, of course, one thing we can't guarantee is funding for the facility. However, I can tell you that about 2 months ago, we had someone that called us that was actually up in a hospital, and they called us. We set up with a provider. The next day, one of our coaches went out with a tablet, and they do telehealth, right? Because a lot of people, I don't know if y'all know this, but in Scott County, is transportation is a big issue. So our coaches will come to you, and they'll bring a telehealth tablet with them, and you'll meet with the provider. And what happened on that particular one is our provider actually got a sponsorship bed for one of our people, and so that was 100% free. And we do have those kind of relationships with people to be able to get people in. Can I guarantee theirs?
But your stuff stops
Yeah.
at the door.
But but as soon as you get out of that, say it's a 28-day,
It's back
we're
in.
right there with you.
Okay.
Our recovery coaches walk with you the entire way, as long as you want us to. We don't have a timeline on a year, 6 months, 30 days. As long as you want us to help, we're there.
Okay.
So, I did want to let you all know, I'm very proud of these numbers. Throughout the state, what this looks like the program started in April of 2020, so COVID. There has been over 24,000 Hoosiers that have reached out to help with this program. That's huge.
job.
I'm sorry, 24? I just got corrected today. 27. 27,000 people have reached out for help. I can tell you in Scott County alone, we did over 1,885 interactions just in Scott County. We now have, right now, 362 active participants that are still getting help with our recovery coaches in Scott County.
How many was that?
362. Then in the last 30 days,
So is that in recovery or is that in your program where they're coming to your meetings and?
yeah, so
And-
that's a great question because it's in our program. And what that means is it could be transportation, it could be housing, it could be getting connected with the trustee, right? It could be whatever resources they're looking for. Because the one thing our coaches are great at, they're conduits of resources, and so that's our service. I will tell you this, out of the 39 in the last 30 days, over 50% were out of Scottsburg. 50%. Within those, we have referrals from community corrections, recovery residences, which is the old term used to be transitional living or something like that. So recovery residences, we actually go to the recovery house and meet with them to see what their barriers are. We have coaches that are very good at helping you get your license back. Of course, insurance navigation, employment, stuff like that, resume building. But we have referrals from community corrections, recovery residences, the emergency department here in Scott Memorial, probation, Life Springs, DCS, the jail, and over 25% of our participants actually come from the syringe program. And that's 25% of the people just last month that got referred from the syringe program are now walking in their path in recovery. So very proud of those numbers. We are also involved with FSSA again in as of July 2020, they took over the 211. So if you actually if you hit 6 and then 2, you can actually speak to a peer recovery coach right away. They also have a crisis if you need to speak to somebody in a crisis. Let's see, I want to make sure I hit this. I'm so happy about these things. I do want to say this, and I'm very, very proud of this, is that when I came here So I'm a transplant, so thank you all for welcoming me to your county. But when I came here in 2016, there was a big stigma and things that were going around, which I'm sure we'll hear more about. But I just want to let you all know that what we hear from the national level now is Scott County is the model for recovery. National model for recovery. And I'm very grateful that I got to be just a little piece of that with you guys, to be able to bring people that are, I'm going to be completely honest, and I'm allowed to break my anonymity. I'm also someone in long-term recovery. I'm a former police officer as well, and so these are some hard things to admit, especially the stigma of being a law enforcement officer and then living in Louisville, Kentucky under a bridge for a year. And then now I get to be here and giving back to the community like we're doing today. I want to thank you guys for the work that you all have done to get us to the place that we are, to be able to be a national model. And so thank you for that. Also, one thing that we did as well, and I'm going to apologize to you all up front because I heard some conversations about it. We partnered up. If you haven't heard, that Governor Holcomb signed excuse me.
I did.
Oof, a little water, Mike. Signed something in to law of the naloxone boxes. So we partnered up with Overdose Lifeline. With Justin Phillips runs that organization out there. That's also a part of the Good Samaritan Law, or Aaron's Law. And we put 2 naloxone boxes in the county, Scott County. We have one, and this is the longest name I've ever heard for a church, the Pace Race Building, the New Covenant Church in Austin. We have one there. And then we have one at Thrive, which we're in the basement of 396 West McLean Street at First Presbyterian Church.
Well, I got a question about that, because
Yes.
I know I've asked the health department before.
Yes.
And at the time, they didn't know anything about it.
Yep.
So, I guess, with that, who's got access to that?
To the boxes, anyone that needs it.
So, but I mean, what if it's somebody that just doesn't need it? But I mean, how do you know when it's open and when it's closed, or, because, I'm just curious. I mean, we're a rural community, so in a rural community, it's a little different than, like in a Louisville, where you'd have it on the corner and you say, okay, I'm going down there and get
Right.
this Narcan. I mean, are you seeing that it's being, I mean, I guess I'm trying to figure out how it's
Distributed?
distributed.
Yeah.
Because I could see somebody just driving by and going, or walking by and going, hey, I'm gonna go get that Narcan out of there.
Yeah.
I also had an overdose one time that we were chasing around in a car, and they were trying to find Narcan, driving around with the person in the car that had overdosed. But anyway, I'm just trying to figure out how that system works. I understand it's just a box that
Yep.
you can go in and take something out of it, but it's, I guess I don't see it in the sense of, if someone overdose, somebody's gonna run to that box and get
Yeah.
a Narcan. I mean, so it's almost like it's there for you to put in your pocket in case later on something happens. I mean, you explain to me how it works.
Yeah, and that's a great question. And so first off, let me say this. I hope somebody puts it in their pocket in case something happens.
I get
And the
that.
reason I say that is because, as someone that's been Narcaned over 8 times, I've been institutionalized in a facility over 12 times, and I have 16 convicted felonies. One was not enough for me, and it didn't make me stop, right?
I get that.
As long as they're breathing, there's hope, right? So for us, how the boxes work is the kind of the contractual thing that you have to do is we distribute our numbers every month. I've talked to Shannon, got with him this month, and we're actually going to give him those numbers, what they look like on our distribution as well, so that way he can know. But what that looks like for us is every 2 days, one of our coaches will actually go to the box and check on it. Right now, we're around 7 that we keep in there, and I'll be honest with you, the one in Austin, we haven't had to refill yet. The one in Scottsburg, we refill almost on an every day to a degree basis. And we check that.
Are you seeing that when the box is open, they're taking them all?
Well, it's always open. All you have to do is go up and it's
I
turned the
understand.
thing and it's open. No, we're seeing they're taking about 2 at a time.
Okay.
That's what we're seeing. And I'll be honest with you, we installed these boxes on 4 or 5 of April. And as of right now, we've only given out 41, and there's still 7 in the one in Austin and 5 in the one at the rec center.
Now, there's a Sharps container with them, isn't that correct?
The one in Austin is mounted onto a Sharps container. Yeah. But what we're really seeing is in Scottsburg, we're seeing a lot of people, and I love that question, so I'll address that. What we see is the stigma that's still attached to people that may be using that won't go get Narcan from the health department. And so, and even our coaches that are there, you know, if they'll talk to you and they'll ask you, do you need Narcan? If you do, you know, they'll assist you. But there's a lot of stigma to it. There's still a lot of stigma to substance use. And a lot of people feel shame and guilt before getting one. But we're seeing about 2 at a time that go out, and they'll come up to the box. And I would love to invite you guys. I know maybe not all 3 of y'all can come at the same time, so you can coordinate that, Randy. But the first Tuesday of the month, we have our board meetings. I would invite you guys down to see how we operate, to see what we do. And we can show you what the boxes are and what they look like. That's down there at the First Presbyterian Church.
I've been there a couple of times.
Yeah, we're a lively group, aren't we, John?
Yeah, I don't think I knew you, or I don't think you knew me. We
Yeah.
sit on the other ends and look at each other.
Yeah. Well, I mean, usually I like it when people bring me treats, and John just came in and just.
Yeah, there you go.
He's just a treat.
Yeah, yeah. But I also wanted to let you all know, and I know that hopefully everybody here is every Friday night we have a game night where we supply the food, and from 6 to 8 every Friday night, come family, come friends, come anyone, and just have a good, clean, sober connection and fellowship, because we know that this is an isolating disease, and so the antidote for that is community and fellowship in some way or another, no matter what that looks like for you. And then also one other thing that we do is we've partnered up with Foundations Medicine, and twice a month they actually come down and do HIV and Hep C testing in our parking lot. So we're very involved in the community. I'm sorry it's taken so long for me to get here. It was a long walk, but I'm here. You all have my information if you need anything. I think that's all I have. It took me a long time, Mike. I'm gonna tell you right now. It took me a long time to put all them pictures together. I hope you appreciate them. That's all
I'm going to.
Okay.
I'm going to. No, I appreciate what you're doing. I mean, I think the recovery part of this is where, you know, people need to touch the other person, and sometimes that doesn't happen.
Yeah.
And I mean, I know you know what I do, so I see it firsthand. And sadly, last Tuesday we lost another one. So in turn, like I said, I appreciate what you're doing. Every opportunity and every avenue for somebody to reach out and get some help, I think that's always going to be a plus. So.
Yeah. And we ran on a call about 2 months ago. We got a call out, and this person was going to be incarcerated, and he got incarcerated. And we still went out on him, but when he got out, we stayed connected with him and got him into treatment. And then another person that we went out on wanted nothing to do with this, and they signed out AMA from the hospital. Our coach did meet with them before they left, and 2 days later we got them into inpatient. So I will say this, as someone that has been on the other side of that little thing you put up my nose, when they first wake up, they may not be your best friend.
They're not.
And they're not grateful. I'll be honest with you.
I've had them hit me. So.
Yeah, we were never grateful. But I can say, as someone that has also been on that side, thank you. And I'll say it to you.
Yeah.
Thank you, Mike, for what you do.
I carry a case of Narcan in my car. So.
Yeah.
So.
You may not be the first to answer, but I understand that our recovery rate in Scott County is a lot higher than the national rate. Is that?
Yeah, I don't have that number. I don't know that number. I'll tell you what, from what I've been a part of the recovery community in Scott County,
Yeah.
when there was about 4 meetings a week, and we took it to about 15 to 17 meetings a week, pre-COVID, and I know that's the magic word, right? COVID. But pre-COVID, 17 meetings a week. The recovery community in Scott County is still very strong. I'll be honest with you. For people even not in recovery, COVID has been very hard. And especially for the isolating piece for COVID and what it's done to the recovery community. However, Scott County is still strong, and we're opening back up. Things are doing things again. But yeah, I mean, I would say your numbers are pretty high it's the national model of recovery, you know?
Yeah, okay. Thank you.
Appreciate it.
Yeah. It was nice meeting you all. Thank you all for your time.
All right, I guess the reason most people are here tonight, the open forum on the syringe exchange program. How we're gonna handle this is that, I don't know if John wants, I know I'm not personally going to make a statement. I wanna hear from the people. So I guess in an orderly fashion and not to be, I guess, inconsiderate of somebody else or somebody else's feelings or whatever, but just make your for or against your comments, just be polite and courteous, and at any
Come up
time,
front.
yeah, whoever wants to step up and make their comment known, then and actually, there might be some questions that somebody asks. So, us ask questions of you, but, so, just at this time, whoever wants to come forward, Jerry,
Me and Mr. McLean, Mr. U.S. Marshal McLean, I come on.
that's fine. Just pull that chair out. I think I know you both.
It's been a long time since I've been at this
This
stage.
old guy here, though.
First of all, we appreciate you guys having the meeting, be able to learn. Marshall McLean is, I can go first, you can go
Well,
first,
let
it
me
doesn't
just, let me
matter.
just say first, I'm not here as Marshall McLean, I'm here as a former sheriff and a citizen of Scott County.
Good deal,
Yeah, go ahead, Sheriff.
good deal, good deal. What I want to tell you is this, just kind of give you some facts on it. As a law enforcement officer, and I think every law enforcement officer is going to tell you when you hear them say this, it's on its face, how can you be for a needle exchange on its face? Okay, but those who are educated and did their research on needle exchanges, like myself and our department, have found out that it works.
Right.
It works. So what we have done is this, we have embraced with Thrive, we've embraced with other agencies, recovery agencies here in the county, to work hand in hand, and I really think that it's made a big difference for us. For one, this year, and I'm gonna bounce around here, okay, because I've got some other members, and I'll be as quick as I can. For one,
I've got a kitchen timer over here.
I just want to go over some numbers for you, and that's because we see it firsthand, because we've got the jail, obviously, so we deal with the jail, and I think Mr. McLean can talk about that too, because he was obviously the former sheriff. So right now, we get grants from the state of Indiana, from the federal government, and what we did is I went and contacted, I didn't do it myself, we had Doug Harold, our jail commander, contacted the grant people to make sure that if the needle exchange was done away with, that it wouldn't affect those grants. Okay, I want to make sure it wasn't tied to it in any way, fashion, or form. And it wasn't, they're not tied to it. However, what I gotta say is this, we've run a study here of what we have to deal with, and just kind of throw the numbers out here. It's kind of scary, and you'll see if Scott County had to pick it up if something was to happen, if that's, and I see Dr. Box is here. Yeah, so she can, what I'm saying, she can tell us, if it would affect it or not, so I'm glad she's here.
There might be some grants, sir, that are related to HIV and hepatitis C, because that's really what we're battling, in addition to substance use disorder.
And that would hurt if we do not have a needle exchange, that was kind of my question.
We don't fund any other local health departments that do not have
Have
a
needle exchange.
syringe service program.
That's, thank you, we didn't script this, trust me.
Sorry, that's not a threat at all.
Yeah, I get it. No, I get that. But it kind of rolls into what we're talking about, because we did an average of HIV patients that we have in the Scott County jail. We average about 16 since COVID's hit. Before the COVID hit, we averaged, probably up around 30, is that right, Douglas?
Between 20 and 30, yeah.
Between 20 and 30 HIV patients. And the medicine for an HIV patient to get treatment is approximately $5,000 a month. Okay? We have doctor visits, blood work, approximately $1,800 per inmate a month that comes in. We have a 14-hour week that a nurse is sent to Scott County Jail as part of her salary. She gets a donation, or not a donation, but a grant to be in there with us 14 extra hours that we would have to pick up. And that's,
Is that live?
no, that's actually advanced medical, or extra medical nurse. So, and her salary is about $24,000 a year. If you put all that together, this is what we come up with just 16 patients. It's gonna cost the county about $80,000 a month just in medications only. It's gonna cost $28,800 per month for the doctor visits and the blood work. And then the $2,000 a month for the nurse's salary. So that comes up to a total per month of $110,800 that Scott County will have to come up with. Now, per year, that totals out to be $1.329 million. Okay, and that's just with 16.
I got
people in
a
there.
question about that.
Yes, sir.
What,
She's gonna faint. She's gonna faint. She's going down. Get her head. Get her head. Bring her head below her heart, guys.
Make room for the doctor to get through there too.
Dr.
Yeah.
Dave, Jerome's over there.
Got a lot of doctors here.
She want an ambulance.
I got too hot.
Do they want an ambulance?
Hey, Toby, ask the doctor if he wants an ambulance. Yes?
Jeff and Shannon's back there. Jerry.
Okay.
Yeah, Jeff and Shannon's back there.
You send an ambulance to the courthouse, to the commissioner's room. We have a person that's fainted or passed out.
What are you getting up for?
I saw her get up.
I'm still on, so watch it.
That'll be next.
I think they turned the AC off at quit time.
Push that black button on the side of that thing up there.
Randy just turned
Tammy, can you stop this for a minute? We're gonna resume here, and I guess one of the questions I was getting ready to ask the sheriff here was, he just told me, gave me a number of, I think, 1.4, $1.5 million for drugs and doctors and the such. I guess I was gonna ask him what 86 other counties are doing that, or 84 counties are doing that don't have the needle exchange.
I don't know. I don't have no doubt. Well, some of them may not be treating, some of them may be releasing. But to me, and of course to the former sheriffs that made the decision, if we have someone in the jail and have HIV, it's our obligation, we have to treat those folks.
I understand
and get them best. Yeah.
Well, wouldn't it, I guess I'm gonna ask a question here, because I know we've released a lot of people since COVID. But I mean, if you have, and not even an HIV or hepatitis or, you know, any kind of, person with any kind of disease, but if you had a heart patient, if that person is a high risk for a medical event or cost, would you not try to release those people?
It would totally be dependent on the crime they committed.
I
Obviously, we would
get
not
that.
release a child molester, or we would not
get
release, you know, a murderer.
And that wouldn't be your
or something like
decision
that.
anyway.
No, that's the judge's
No, but-
decision to do that.
But you guys would go to the
What we
judge,
would
the
say to
prosecutor,
the
and
judge,
say.
yes, right, what we would do is we would go to the judge and say, we've got a high-risk, patient here in the jail, that's non-violent, level 6 or misdemeanor, you know what I'm saying?
Yeah.
And sometimes they'll put them on home incarceration or other options,
Yeah.
but those are
But out of
obviously up to the judge.
But out of the 16 or pre-COVID, or I guess COVID and pre-COVID, it was 20 to 30. Would any of those people be eligible to be released?
Not very many, no, because the folks we have now, it's like 16 that are in there, okay? Those folks, they've already, all the COVID releases is already done, so this is the ones that can't be released because it's, you see what I'm saying, they're already at the level of crime that they cannot.
So they're not incarcerated for a drug-related charge?
Well, they may be, but it may be like a level 2 or level 3 dealing.
Okay.
It's a serious charge, yes. Mhm.
All right, that's the question I had. I mean,
Yeah.
twofold. One, what are other people doing?
Yeah.
Because there's 9 counties, found out. I always thought it was 6, but there's 9 counties that have a needle exchange out of 92, so I wonder what the others are doing.
Yeah, and I can't answer that, you know what I'm saying, because I'll just be honest with you, and this is a tribute to everybody here, is because Scott County's been the leader in this, and I ain't looking back, I'm not looking at what everybody else is doing, we're creating it ourselves, we're the one that's leading the pack.
Yeah,
So,
so,
Sheriff, I think you have to remember that not all counties have the high prevalence of HIV that Scott County does. And so that's going to mean that more of your incarcerated individuals will have HIV.
I have a question about that.
Yes, sir.
And you gotta forgive me for a second because I came from a water tower industry. I traveled a lot, and back in 2015, my memory ain't real fresh about that. But was we testing for HIV prior to that number when we,
Yes.
so how did we get, I mean, because from what I hear, I mean, it went pretty fast, so
Yeah. There was a
how did it go like that
There was a
quick?
new drug called Opanan.
Opanan.
Which basically individuals were using and shooting up much more frequently and sharing needles with that, and that's how that got spread so quickly. So you went from Indiana having maybe 500 cases in a year, and you guys had 240 cases, boom, all at once.
And it was cheaper too, wasn't
It was a cheaper thing,
Yeah.
yeah, but I think what Randy's asking is, prior to 215, and I went online and read some stuff to where a scientist or a mathematician was trying to go back and do some sort of study to see prior to 215 what the numbers would be. I don't know how, I mean, I'm not a mathematician, but I don't see even how he did it. But I think what Randy's asking is, prior to several people being HIV positive, were there testing in Scott County for HIV? And I'm saying that only because who's gonna walk in someplace and say, hey, I want an HIV test? I'm old enough that I was around in the 80s when HIV came
know what
around through
caused it?
sexually transmitted diseases. And at that time, you change your lifestyle, and that's all pretty much what happened. I guess where I'm asking is, and I think what Randy's trying to say
Exactly right.
is that all of a sudden, we're testing, and then all these people test positive, but do we know that in 215, or were they 208,
No,
210?
we know that, and for those of you who don't know, I'm the former United States Surgeon General, and I was Dr. Box back during 2015. We called the CDC in to look at not just the population and to do surveys and to ask them where your high-risk contacts were, but they also collected blood. And they also did testing on the strains. And what they determined was that these were new cases. These were not cases that had been sitting around for years or even months. These cases started right at the time when we saw the use of Opana and the needle sharing really increase in Scott County. These were new cases that happened because of the activity that we saw, and that's why Scott County was a bellwether for the rest of the country and other people around the country using these new, more potent narcotics out there, and also sharing needles. And it's why Scott County, when people saw what happened here and saw the amazing response, thanks to everyone in this room here, you saw syringe service programs around the country increase precipitously. It's why President Trump actually included syringe service programs in his plan to end HIV in America, because of what we saw happen here, because we could see it started here and you were able to get it under control, go from 150 cases in that first year to one case last year. That is just truly amazing. I mean, we've never seen anything like that.
And Mike, in answer to, I think, part of your question, yes, we were testing prior to 2015, but we had only had 5 diagnosed cases in a 5 to 6 year period in the county prior to 2015. So it wasn't something we were seeing much at all. It was virtually unheard of in Scott County to have HIV. And most of our residents at that time associated HIV only with, sexual transmission. They were totally ignorant of it being able to be passed and transmitted, through IV drug use.
I guess where I was getting at is that
Testing was available, but yes, there wasn't widespread testing for those reasons.
I wouldn't know how many people would just say, hey, I want to get HIV tested today. And I guess that's where I was going with that is, yes, if you went to a hospital and had blood work done or whatever, they could, find it out that way. But I just wondered how many people were walking in someplace and saying, I want an HIV test today. So anyway, back to the sheriff.
So we talked about the money, 1.3 million, that's what we would have to come up with, and if it was more, obviously it'd be double that if we had, 32 patients in there. Next thing I want to talk about is actually the needles, okay? When the needle exchange first started, and we first had the HIV epidemic, there was a lot of people coming to Scott County throwing a lot of needles.
Mm-hmm.
Not only the health department, there were several different agencies that were doing that. There was no accountability on those needles. And I'm just going to tell you right now, we were picking them up 100 a day. You couldn't walk down the street unless you seen a needle, it was terrible. But since that's all been washed out and the health department has taken it over, it has been a tremendous decrease in the number of needles that we find. As a matter of fact, I will tell you this stat here today that came from our CAD system. Of course, this CAD system is only as good as the information being put in, as everybody knows. But as of January 1st through May the 1st, we had only picked up 2 syringe needles on the streets. Now let me preface that by saying.
I'll call you next time I see him.
Okay, yeah. Well, that's what, I have to preface that, maybe people are picking them up themselves too.
I dump them in the box over here by the Life Spring, so.
Yeah, but that's what before that, it was nonstop all day long, all you were doing was doing the needle pickup. So, and I'm sure that the health department can give that on what they do and what the return rates are with things like that. What scares me on the law enforcement side, now that I've talked on the money side and I've talked on the jail side, what really scares me to death is that we're getting these needles, they're not on the streets like they used to be, okay? When we stop somebody, if they got a needle and they got a needle card, then they say, hey, I got a needle card, you know what I'm saying, I got a needles in my pocket. Before we were doing that, they didn't have nothing on them, and we had to try to pat them down and find them, and we was getting officers stuck, okay? We've not had that problem anymore because people are being honest, because they know how dangerous the needles are, and they know that the officers, can get hurt with them. My fear is that if we go back and would take the needle exchange away, that now every single time my officer comes in contact with a guy or a girl, that if they've got a needle, they're gonna be afraid to say, I've got it on me, and we got the possibility of, you know what I'm saying, of getting stuck again. And I think that's a very, very valid, thing that could happen. I spoke to my officers about it, and that's what scares them about losing the needle exchange. Further is this, I'm just gonna be honest with you. When we find people with needles they ain't supposed to have, we arrest them. You can see it in the newspaper. We have literally kicked the tail out of drug dealers in Scott County, as you very well know. So it's not like we're letting this stuff go. It's not like we're not reporting the ones we find. We're arresting these people for having them, the ones that shouldn't have them. So I just think that what'll happen is before, whenever needles, we didn't have the needle exchange, people would go by and they'd see a police car and go, oh crap, man, throw the needles out. 2 or 3 of them hit the ground, you know. And we've not seen that now. And I'm afraid if we go back to that could start happening. They'll start emptying their needles out in the ditches again instead of taking them in and turning them in. Yes, sir.
I've had a concern, and I'm with you on this area you're going here, but if we quit collecting, they're getting like 85% of the needles back now. And if we stop that, that's thousands of needles we don't know where they're gonna end up at. My guess is, and somebody in the health, oh, y'all can tell me better, they'll probably go and all around down to Clark County and get their needles. Is that an accurate assessment? And they'll bring them back up here, and the ones that aren't running down there and bring them back up will start sharing again.
Or they'll get them underground, because there'll be community people that bring the needles into your community even when you don't have a legal syringe service program.
So by my estimation, we may have more needles than ever on the ground.
That's exactly what my point was getting to.
And that's always been my biggest concern, by the way, not the program. I know the program works. It's always been about needles on the ground. And for the group, the group that went up to Austin with us last week, the numbers came way down what we picked up. So it's worked. I'm sorry, go ahead.
No, it was me, and I feel like I need to say this, like, anybody can get on Amazon. You can get on Amazon and you can order syringes. They're $16.99 for a box of 100 of them, and you can have them delivered to your front door. No prescription needed. So,
and you can go to the farm stores too and get needles also.
But you'll still be able to go to Clark County and get freely. Is that accurate?
accurate.
I can probably speak to that a little bit though, from Clark County.
Yes, sir, thank you.
And, you know, I work with LifeSpring up here as well, and I mean, we have trouble getting people from, you know, Austin to Scottsburg for services, let alone to come all the way down to Jeffersonville for syringes. And I mean, so what you're gonna see is just an explosion in sharing and, you know, old needles and things like that. I mean, we will accommodate everybody that we can in those scenarios, you know, but that's what you're gonna see. You're not gonna see people drive down. They're gonna go through, what, 5 or 6 police jurisdictions, being scared that they're gonna get pulled over. There's just all sorts of barriers to that. So it's just really not a viable solution to think, you know, well, they can just come down to Clark County, because that's not gonna
Well,
happen.
and I would guess if everybody went to Clark County, somewhere along the line, they would just shut it off. for
Right,
us.
right. Yeah.
And in which case, then it would just all go back to sharing.
Yeah, if I could, guys, from, you know, I was front and center when this whole thing broke loose, and it was a, you know, our problem didn't start in 2015, it started back around 2011, when the Opana and everything started, when they started doing the anti-tamper pills and all that. People started cooking them down and shooting them up. So it didn't happen overnight, and the decision you commissioners make, whenever you decide to make your decision on this thing, is probably not going to affect the community immediately, but years down the road, it's going to have a immense effect, okay? Because we know when people get HIV, their health doesn't really start deteriorating until years later, right? That's when the medical services and health services are going to start being overrun by these folks that have HIV. It was a chore to get this thing in place, and we did it because we had a major HIV outbreak, and we got that under control. My fear is if we do away with this, the outbreak, the sharing comes back, the HIV comes back, the law enforcement has to start dealing with the bigger threat of getting HIV to their officers out there. The medical services start getting overwhelmed with the people coming into the emergency room, into the ER, and that we have to provide doctor services for them. The county has to start absorbing not only expense, but the threat of an HIV outbreak once again in their community. We got national, if not international, recognition because of this. Now, on the good part of that, because of the wonderful not wonderful recognition, the recognition we got, we were able to pull in all kinds of resources and assets with the state. Came in, the CDC came in, most of the people in this room stepped up to the plate, started all these wonderful recovery programs you see in place right now. And because of that, we're on the road to recovery, and we're setting a precedent for the rest of the communities. And this is a national problem. It's not a Scott County problem. It's national. We're setting a precedent for how to go forward on this. I say let's stand firm. Let's keep this thing going, and let's do it the best we know how. And if it needs some tweaking or some adjusting, let's make those fixes and continue on with it.
Absolutely.
Okay, thank you.
And in closing, I'll go ahead and close, and everybody's getting tired of hearing me talk. Is this, as again, as law enforcement officers, you know, we cringe when we hear you got a needle exchange. That's just natural action, because that's what we arrest people for, okay? But I will tell you this again, those educated officers, and I'm not saying I'm educated, but I did my research and I found out when these two doctors over here tell me that you need a needle exchange because it keeps disease down, it keeps from spreading, then I'll guarantee you I'm gonna listen to what they say, because I'm not.
Sheriff, you guys can answer me this. If for some reason we opt out of this program and it's over and the spread starts again, can we get back in?
That'll be up to you.
No, I mean, it's still available, it's still available for us to vote later and get back in the
It is,
program.
we just extended it, so
Yeah.
it'll be 5 years before it
Okay.
comes up again.
Well, I was concerned about that. I've heard here and there that maybe once it's over, it's over.
How long did
you say?
We extended, it'll be 5 years from next year.
2026.
5 years.
But we still have to vote every 2 years on it.
That's, you guys, I
No,
think, will do that.
no, you can vote every year if you want. In the beginning, we voted every year. Since COVID happened last year, we actually extended to 2 years before we had to vote in. And actually, I was told at the time that we could vote at any time to change it, or one way or the other. If you want to, you know, do away with it, you can ask for a vote at any time, and you can actually, if you know what
That is true.
she said, if you want to bring it back, you can vote it back.
But if we do
Back the other
nothing, the
way.
program continues. Is that correct?
If we don't vote, yeah.
Yeah.
Can I remind everyone that this epidemic happened in a matter of a few months? I'm talking about like 200 and something of people.
I'm trying to get, we're
Yeah,
trying to keep
we
this
gotta get-
organized.
And I'm getting ready to get up right now, okay, but
We'll get
before I
up.
do, you know what I'm saying? I think, you know what I'm saying, you understand is this, for the safety of our prisoners, for the safety of our children, for the safety of our officers, for the safety of Scott County, I have to say that I am a big supporter of the needle exchange. And I think we need to keep that just for those reasons that I expressed.
Okay.
And if I could, guys, one more thing, I'd just say follow the science on this thing. You know, do the pluses and minus list on there. What positives we're bringing out of it, the needle exchange, the services they bring, you know, the opportunities that these people receive or have the opportunity to receive when they go to the needle exchange. I don't have the numbers on that. I'm sure some people in this room do, on how many people are taking that opportunity to get help because they're showing up, these counselors are talking to them. And what's the negative of keeping the thing going? You know, what is the negative of keeping, I really don't know, I need somebody to tell me that, but I know the positives of keeping it going. So, that's all I can say.
You would know.
At this time, I'm going to ask the Scott County Health Department to come up, because we got a one-legged doctor over here and needs to get out of here. I'll get to you in just a second.
Oh, no, I'm not sure there's gonna be anything that
Okay,
I need to
all right,
say.
okay.
At the end of all this,
You've
you're
already
doing such an amazing
Like
job.
I said, I just want to,
No.
I know he can only sit so long.
Thank you, Mike. Well, as you know, I'm a longtime Scott County resident, been health officer here for over 20 years. First, we'd like to just thank everyone for the enthusiasm and support that they're showing by attending here tonight. I especially would like, though, to have just a few seconds to thank Dr. Christina Box, our current Indiana Health Commissioner, and her team coming from the State Department of Health, and especially Dr. Jerome Adams, who was the state health commissioner at the time of the outbreak, and who was with us from day one, and is still with us, as is evidenced by his attendance tonight. As we know, we had the largest outbreak in the country in 2015. Like I alluded to earlier, the prior 5 or 6 years, we had only 5 cases of HIV diagnosed, something just was virtually unheard of here. And then suddenly, we were the largest outbreak in the country. And as a result of the governor, of course, declaring a state of emergency, we were the first to start the syringe service program. We, I think, as has been mentioned before, have sort of been the poster program for that in a small rural community. And I'm very, very proud of that, but I think it's everyone here in the community that's had a part in that. I had some significant reservations when I was first, asked to consider starting the state's first syringe service program here. I questioned, well, was it going to enable, our patients and our citizens who were suffering with substance abuse? But I did a lot of research, talked to a lot of people in other communities, both metropolitan and rural, both in this country and outside this country. And after that, I felt that it was the only answer for us. Our first goal was to, limit the harm that was being done. And of course, a lot of harm was being done because of needles in the community. The syringe service program, I think, is first an instrument to limit harm to our citizens, and I think it has certainly done that. And as I say, even though I thought there could be the possibility of it enabling, addicts here or substance abuse sufferers, I found that yes, it was an enabler, but it was an enabler in such a positive way. It enabled us as healthcare professionals in the community to have access to those we needed to have access to. Many of those people, the last thing they wanted was to show their face anywhere. They thought they would either be arrested, or they thought they would have all the stigma of, throughout the community. They weren't showing up for any services. When we started the syringe service program, because they realized they could get clean syringes, they came hesitant, very hesitant at times, and very reluctantly at times, but little by little, they came to our program. And they saw that when they did, not only did they have access to needles, clean needles, but they had access to, number one, people who showed them concern that they had never been shown before, showed them empathy, showed them care, and gave them care. And this was, one of the most important parts of the syringe service program from my perspective. So it enabled us to have access to these patients. It enabled the patients who are suffering from HIV and Hep C, to have us and feel comfortable, to come to us, and then therefore have access to counseling, substance abuse treatment, treatment for HIV and Hep C. And so yes, it in a way was an enabler, but an enabler in a very positive way. So I could, talk on longer. I want to say though, because of a recent bump in the road that I encountered.
You were the bump. Weren't you the bump?
I have a little bit of a physical handicap and a little bit of a cognitive handicap just due to some of the medication I'm on for recuperation. So because of that, I'm going to turn the program over to my administrator here, Michelle Matern, and then we have a number of guests and others who are experts in their fields who are going to give you a lot more information.
Okay.
But certainly from my perspective, and having been a lifelong Scott County resident, I think the syringe service program has been, a godsend to us really, and I cannot imagine our community functioning as well, especially with health concerns, without it.
Okay.
Michelle.
Appreciate that.
So I talked to all of you and you said bring your information, so that's what I've done. Mostly just reading material. We're not gonna like go through every inch of that, but so in the beginning you will just have some information just about basic HIV 101, Hep C 101, and then just some quick slides about the program itself, right? Because that's kind of what we're here to talk about, is how effective the program is. So obviously it started back in 2015, and if Erica was well, she would kind of touch on this. This was your question, Randy. The State Health Department has a surveillance team, and they kind of monitor statewide HIV, Hep C, STDs, and so they have things in check, like all pregnant women get checked for HIV. Anyone who goes into the Department of Corrections gets checked for HIV. And so when they kind of saw some upticks from people in Scott County, they were already kind of looking, it was already kind of alerting. And then when somebody does test positive for HIV, there's a person called a DIS worker, a disease intervention specialist. They will go out, track that person down, interview them, go through how, you know, what they could have done to possibly get HIV, and then they will offer testing to anybody who has that. And at the beginning, went to somebody, tested everybody in that house was positive, and then that's kind of when like sirens went off and things got, you know, to the next level. So on a simpler story kind of like thing, that's kind of what happened. So we do a needs-based program, which basically means that we provide syringes as the patient or participant needs them. And I like to say it's more of like a hybrid for us. So somebody comes in, we do a detailed kind of interview intake process, ask them how many times that they would need a clean needle for every single time they inject through a 7-day period. So if they inject once a day, that's going to be 7 needles. If they 2, that's 14. And then give them packs of 10. And so if that person doesn't bring that back, we only give them a minimum of 10 each time until they can kind of earn that trust back of they bring those 10 back, and then we'll slowly increase them to what the level that they were.
Where are they packaged?
How are they packaged?
I said, how many are in a package?
10. So that's the minimum that.
So is that how it was in the very beginning?
No, I think more in the 2015 was more completely needs-based. So whatever they needed to have a clean syringe for every single time that they injected, they got whatever they asked for, up to 140.
Now they're packaged in tins.
They're still packaged in tins, but more of that hybrid, like they have where we only give them the 10 if they don't bring some back. 2015, 2016, it was more of completely needs-based. If they didn't bring any back, we obviously asked them why. A lot of the times it's went to jail, no longer at the living at a different place now.
I thought they were more, from my understanding when it first started, when I first became a commissioner, came up there, I thought they were packaged more in a box than the 10, because
there's a box of 100.
Like,
yeah.
Here's 100 and we can't split them up.
It's 10 packs in a box, 10 of a 10, so there's 100 in a box.
All right, so they're packaged 10.
10 is the minimum, 140
and the
is
reason
the
being,
maximum.
because there's a lot of people ask me, why are they giving them so many?
Sure.
And I try to tell them that they're sterile, so
Yes.
once you break the package
Yes.
open, you have to give them all.
Yes.
So,
yeah, we don't want to get out.
I get it,
We're on the same page. Like if
Okay.
so, somebody needs 14, we're not going to give them
Yeah.
count out 14. We're going to give them 20.
Yep, I get it.
Yep, perfect. And with that, they get the box to put them in, alcohol swabs to disinfect the skin. I think there's probably some other people in the room that's going to talk about what happens when your skin is not clean and what kind of medical conditions can stem from injecting with dirty syringes. Another common question we get asked is, can diabetics use the program? Yes, absolutely. I think almost every week we have somebody who either brings in syringes that's a diabetic or asks us for diabetic syringes. And I mean, you can clearly tell when someone is a true diabetic or someone who really wants to use the program
So
for
to
this.
clear the air,
Yes.
because I had this conversation this morning with 2 diabetics that said they're buying their needles, and I said, you can go to the health department. I've told you this before. You can go to the health department. They'll give you your needles. They go, they act like they have, and they were not giving the needles. So I'm going to make sure
Yeah.
that, and actually,
Yeah,
I did
as for
talk
me.
to, I did talk to him, so I wanna make sure that if we have diabetics in the county, that they can get a needle as well, so, or
But we
their
only have
needles.
certain sizes, so if they require a different size, we may not have those in stock.
Okay,
Yeah.
well, but,
Or if they use like the insulin pens, we don't have like the little pens, we have
Yeah,
just
I
the
get that.
syringes.
I
But we
get that.
have 3 diabetics that we see every month. We, dispose of their
Well,
used ones and we give them their new
I
ones.
drop mine in the recovery box, so. So if you see them wrapped up in a big rubber band, those are mine.
Okay. And then your next page there, it kind of talks, or you can kind of see that we're on a downward trend of syringes that we gave out. So we're not giving out the same number of syringes that we were in the height of the outbreak. I know that's a question a lot of the time, so,
So the amount we're giving out now is less,
less.
not
Mhm.
more? Okay.
Correct, yeah, so for 2021, we're projected to give out, around 125,000. And then your next page, your blue and yellow bars, you're gonna see, active participants and new participants. Active participants, as defined by the State Department of Health, is, someone who's used the program at least once in the last 12 months. And then new participants, obviously somebody who's been there for the first time. We're seeing a downward trend in new participants, about the same for active participants over time.
Why is that, Michelle?
I mean, and generally speaking, I mean, the drug, I mean, it's just generational, right? So we have more people who unfortunately fall into that cycle as we do have people
Well,
who
I'm
fall
trying to
out of
figure out
that
whether that's
cycle.
bad or good. If there's less participating, is that good?
I mean, I think you could see it both ways.
Yeah.
Yeah.
Yeah,
We obviously want people to participate so that they don't spread disease,
yeah.
but if we have less people participating, hopefully that means more people are in recovery.
When you say less people, that's less new people, not people we've been treating all along. It's new participants.
Well, so the blue bar, those are active, so they could have came in just at least one time in the last 12 months. It doesn't track them year to year. I mean, I could individually pull up somebody and say, when they enrolled, was it back in 2015, was it 2019?
So it rolls over from year to year, and then you add people or people drop off.
Right, so
Okay.
that's not saying every single person that's in 2015 is also included in 2020, it's just a number,
Okay.
so.
And some of those are in recovery, so they're off the numbers.
Yeah, they haven't been in a year, they're off the numbers. Your next one, which is the black one, that's kind of an average of how many syringes we give out per visit. Again, trending downward, so about 70 syringes per visit, of the first quarter of 2021. Back in 2017, we were up to 115 per visit.
Does each one of these people get a sharp container?
Yep.
And you know how many can fit in a container?
Right, yeah,
You know what
so
you get back
some
by
people need the big one, this is the gallon size.
Yeah.
Some people want the 2 small ones, some people just want the small ones, so, lots of options
Okay.
there. Mhm.
Well, I'm going after you count, I assume you don't count individually, but if you
Yes,
got
there's-
this much you get back, you know somebody's not using.
Correct,
Yeah.
yeah, for safety reasons, obviously, we don't open up the boxes and count every single individual syringe.
It's an estimate.
Estimate, yeah, but we, we take that very seriously, so we're,
I know you do.
yes, and even if they tell us one thing, the girls, look at it, and so if they feel like it's less than what they say, then they put down less than what they say. Yes.
You mean you can't trust them?
Well, we just, like I said, we take a lot of responsibility, a lot of.
I get it.
yeah.
I hear you. Yeah, you're doing good.
Yeah, no, and I mean, I can't speak
Verify.
for,
You gotta verify.
yep, exactly. And then another question we get asked a lot is our return rate. So the Lifetime program has a 92% return rate. 89% of that is our participants. 3% of that is your community, so that's your law enforcement community pickup, the boxes, all of that's that 3%, and then of course 8% is unreturned. Top 5 program referrals right now, substance abuse treatment is number 1, then HIV testing, harm reduction education, Narcan, and then peer recovery. And then the two girls who work the most of our program, they are both peer recovery coaches. Then you guys have the state, prevalence and then the new HIV cases, and that's kind of what Dr. Box was talking about earlier. So that blue line is going to show you how many people live in Scott County, and then that red line is going to show you how many new cases we've had over the.
What page are you on?
Yep, go back the other way. So that is your intake form. So we ask that questionnaire every single visit. How we record all of our information. Every single person that comes in gets that, whether it's their first time or their 1,000th time. They get asked that questionnaire, and we fill that out and put that into the state database.
Okay.
Yep. And then that one shows, so the blue is going to be people who live in Scott County. Red is going to be new diagnoses per year.
That was a question I had, was that each time a person comes in to get, needles, I guess, there is an interaction to where they're not just like I was gonna say McDonald's, you can't get a McDonald's right now, so. But you go to the counter and they just say, they don't just hand them the needles and they walk off.
Right.
You have an interaction with them.
Yes, that
Okay.
2-page
Okay.
intake form there, and that is provided by the State Department of Health, so every syringe exchange program uses that.
Okay. So it's not, they're gonna have to have some sort of conversation.
Yes.
With a person before they.
Yes.
Okay.
Like I said, and somebody asked me this week, well, if it's they've been in there all the time, is it shorter? And I'm like, honestly, the regulars are in there more throughout the week getting food or other things, so we talk to them,
Okay.
more than what I think people think, but.
And like that interaction can be significant.
Well, that's what I'm saying.
Yeah.
If you don't have that interaction, it's kind of for naught. I mean,
Yeah.
'cause-
Because,
Right.
it's an opportunity to educate, it's an
Yep.
opportunity to sign people up for
And that's-
insurance and.
Yeah, that's what I was getting
provide
at,
So
is-
many services that these patients would not have access to otherwise.
Okay.
And Mr. Commissioner, it's important to note that this is different than the way a lot of other syringe service programs, particularly in urban areas, work. A lot of them do just hand out the syringes, and the reason is, you still have the benefits of preventing spread of HIV and hepatitis, but I say this not to argue that we should do it that way. I say that because the people in Scott County and the people at the health department and the community support folks deserve credit for making sure every single one of those touch points is taken advantage of. You all are doing it the right way here. I mean, I'm telling you, I've seen syringe service programs all over the nation. I've been to Canada and seen how they do it over there. And the way you're doing it here is the way it's supposed to be done if you want to maximize impact and touch points.
Yeah, I agree.
Thank you. And then the smaller graph kind of shows hepatitis C rates, where we compare with Indiana, which unfortunately we are above the Indiana average with that. And then your bars here kind of talk specifically just about HIV outbreaks. So how many people have been diagnosed? So total 237 people are linked to the outbreak. Unfortunately, there have been some people who passed away, so our total number is 229.
Hang on a second.
Yep.
But did they pass away because of HIV?
I mean, I can't say for sure. I don't know.
Well, I mean, if you know that someone was in the program and they're deceased, I mean, wouldn't you know if it was a?
We have had a couple pass away from having HIV and other, health issues with
Well, I
that.
mean, it's kind of like COVID. I mean, if you die in a car wreck and you got COVID, COVID's on your death certificate, so.
No, I don't.
Okay.
We'll agree to
I'll argue
disagree
that
on
another day.
Yes. But like if someone dies of pneumonia and they
But
have
technically-
HIV, it could say pneumonia and AIDS. Whereas if they also die of COVID, it may say pneumonia and COVID.
Just to clarify what I just said, is that people need to understand that on a death certificate, there's multiple layers that you
Correct.
can put on there for what you died, when you died, what you had. And that's why I'm saying that there's a lot of people that died of a heart attack, but they had COVID. I mean, so COVID's on their death certificate as well, so.
We're not gonna agree on that.
I know, we're not gonna go there.
Okay.
And a few of our people that have, that were HIV positive and have passed away have been from overdoses.
That's correct. That's where I was getting at,
Yes.
because, technically, and that's why I was asking you, technically, no one in Scott County has died of HIV.
I've seen a death certificate with AIDS on it, yes.
We've had people die.
I don't know who you are,
My
so.
grandmother
sorry,
died of
Doctor.
AIDS in this county.
So you're telling me that on a death certificate, the only things on the death certificate is HIV?
No, I've personally taken care of them and knew that they had opportunistic infections that led to the death.
I understand that, but, okay, never mind.
There's an individual who, the state tracks a number where either you pass away from HIV or you pass away from a diagnosis of AIDS. Like that's the first time you've ever been notified that you have, HIV or AIDS. Unfortunately, I know of at least one person that happened to here in our ER. Individual is not linked to the outbreak, but that's the only one I'm aware of.
Okay, all right, that's just a question, honey.
And Dr. Box may be able to kind of explain how they come up with knowing that those 7 people died were linked to the outbreak, or, I mean.
It's all decided by the physician that oversees the death at the time, and they're the ones who write down on that list what contributed to the death of the individual.
Yeah.
And it's not something that the State Department of Health does.
Yeah, I get that.
So that's our kind of number is 229. Then care coordination, that's a service that we do at the one-stop shop at our Austin location. So basically, HIV positive, you can qualify for non-medical case management. We kind of help you guide through this path, of HIV and all the new things that come with that treatment, medications. I think like Dan McClain was, or somebody was saying, travel, all that good stuff. We help them with any way that we can, treatment, all that. And then virally suppressed, that's when you have such a low amount of HIV in your body that you cannot pass it on to someone else. So that's what virally suppressed is. And so as of March 9th, 173 people have reached that level.
And if I can just interject, that is 11% higher than the state average.
So the viral suppression rate in your county is one of the highest in the nation.
I guess I have another question, since you're talking about 200. Does anybody, once you have a person that is, I guess, HIV positive, do they ever come off of your reports?
Not the outbreak report. If you're linked to the outbreak, you're linked to the outbreak. If you, like the individual that passed away, not linked to the outbreak, contracted HIV in a completely other way, not going to be associated with this number because they're not outbreak related. And that's where it comes into like the blood testing and the...
So actively, your active number is technically a good number, because sometimes, people move, they move out of our county and they're gone. I mean,
Right.
Or heaven forbid, they pass away. I mean,
Right.
Or, but
Well,
I guess I'm wanting to know, does the number ever come down because of those factors?
So that goes back to that other page where 153 people live in Scott County with HIV, but then this says 229. So not everyone linked to the outbreak lives in Scott County anymore.
All right.
Does that answer your question?
Yes.
Okay.
The state tries to keep very close track of everyone with HIV to make sure that they are virally suppressed and that they are in treatment.
Yeah.
That's
And
where
we
I was.
track their movement across the country too. So when we have people move into Indiana, we get reports into our surveillance department, and the same way when people move out.
Okay.
Yeah.
Okay.
Because they want to know how many people are not in those care coordination programs. Because if you're not in those care coordination programs, getting that touch point like we've talked about all night, the likelihood that you'll stay in care, especially if you're somebody who's in active addiction, and we want to keep people virally suppressed so they don't get other people sick.
Yep.
Yes.
I'm sorry.
No, fine.
So how many people, and you might be getting this here in a minute, that has been in your program has passed away from overdose?
I do not know that number.
We're not keeping track of that.
I mean, not everyone who overdoses is in the program.
Well, that's what I'm asking.
Yeah.
Out of the people that's in the program,
So by
how many people have overdosed?
So by Indiana law, and that's in the very, very back of your packet there, If you participate in a syringe service program, you are unidentifiable anonymous. So we cannot ask for your driver's license. We cannot, even though I know exactly who you are, I don't know who you are. So it's really hard to put identifiable information that so-and-so is in our program, but they also died, because by Indiana law, we can't know who that person is.
We'll give those aggregate numbers with regards to overdose deaths, and I can tell you that overdoses from 18 to 19 went down by 20% in Scott County. So it shows that individuals are having touch points with people, getting naloxone, hopefully more of them getting into recovery.
I know that's not the answer you wanted to hear, but.
Yeah, I'm sorry, so we,
How much is it
18,
down?
19, we went what?
Can you repeat that statistic, please, Dr. Box?
2018 to 2019, Scott County's overdose rate went down 20%. And the state keeps those numbers and can give those numbers in aggregate, but obviously it is personal health information, which is difficult to release. I mean, that's not something we tell unless the family says that.
So that basically, that's because of the Narcan.
Narcan, that's one of the most important parts of the touch point with them, keeping people alive so that they get into recovery, and the number of people that you have in recovery, because you have essentially the best recovery program in the state and probably in the nation.
Thank you.
Did you have any other follow-ups to that, Randy?
No.
Okay. Okay, and then this is kind of just some state information. This is your infographic. Talks about we have 9 syringe service programs in the whole state. The average state return rate is 81%, which we're at 92, so 11% above the state average. And then has a little bit of naloxone information there and participants. Also, some frequently asked questions that the state puts together. One of the things I think is really important is, does syringe service programs encourage drug use? And there's been, like it says, many studies over the past 40 years have found the opposite to be true, showing that syringe service programs are effective at reducing the use of injection drug use and assisting people in being successful in their recovery from the disease of addiction, which I think we've kind of already talked about tonight. Then this paper here is kind of a CDC handout about what a needs-based program is, why we don't do an exact one-for-one exchange, why best practice doesn't find that to be true. There you go. Sorry if I'm moving too fast.
No.
I'm trying to talk fast because I know people. And then this talks about policies with syringe service programs. One really good fact that I like to point out is, for every $1 spent on syringe service programs, your community will save $7.58. Whether that's related to treatment of HIV, Hep C, or medical costs, things like that. So I think I've said this many times before to people I've talked to this week. Prevention dollars, much cheaper than being retroactive and responding to a crisis like we had in 2015. Next page is a abstract about a study done by IU professors. It talks about needle stick injuries with first responders, so talking about public safety. If a first responder gets stuck by a syringe, they have a 0.23% chance of getting HIV if not treated with the post-exposure prophylaxis. So if somebody does get a needle stick, they can go to our hospital. They have a protocol in place, give them medication to take for the next 4 weeks to prevent them from getting HIV, and that has an effective rate of over 80%. But if they have no treatment at all, if they just get the needle stick, go home, that's a 0.23% chance that they'll get HIV. So really, really low. I think some first responders maybe don't realize how low that is. But again, and then next section, you guys have some letters of recommendation, so that includes our IU doctor that goes into the jail to see people. She also comes to our one-stop shop. A letter from the person who runs the drug treatment and prevention enforcement up at the governor's office. Dr. Eric Yazel, who's the health officer for Clark County, also is the medical director for Life Springs here in Scott County. And then you have several letters from participants in our syringe exchange, or people who are in recovery from the syringe exchange. And I just wanted to read just a couple quotes. One says, I will always be grateful for the needle exchange because I was so far into my addiction that I always felt hopeless and depressed. And once I came to a breaking point in my life and knew I had to change, I turned to the ladies at the One Stop Shop for help. Another participant who signs the letter as a heroin addict in recovery says someone saved her own life 30 times. The One Stop Shop staff saved me and helped me get me into treatment. They helped me get into the doctor to get the Vivitrol shot, and later on Suboxone when I stopped taking the shot. I honestly believe that program and people working in the program helped save my life. But those stories are really good. Several really good people to read from. And then next you have some articles. One is about what happened in West Virginia. So if you aren't aware, West Virginia kind of went through a similar thing that we did in 2015 on a smaller scale, but an HIV outbreak, implemented an SSP program, decided to do away with it. Now they're seeing a resurgence in HIV cases. It says historically in a year's time, the county would have less than 5 new cases of HIV, so similar to what we would have here. This year, which would be 2020, they identified 32, which is more than double the number of HIV cases linked to drug use that reported in 2019, and that was still with 2 weeks to go in 2020. And then another study, and Dan McClain kind of said this, whenever you're in the national spotlight, there's a couple good things that come out of that, and is that people want to study you and research you. And so Brown University just put out a study, it's under peer review right now, about if we were to close down the SSP. So it kind of gives you that model of what it would look like. It's if it permanently closes, if it's only closed for a short time, if it's closed 2 years from now. And so permanently closing the SSP would cause an average of 62 more HIV infections and a 52% increase in the incident rate during 2021 to 2025. So
that's, at least 12 cases a year, whereas in the past year we had 1 case.
Yes.
And this study was done by the Department of Public Health at Brown University, specifically on our community.
Yes.
Yep. Very, very timely article.
Yes. I'm almost done. And then next you have your legislative report from the Indiana Department of Health. So that is the only time you will ever really get to compare every syringe service program one by one. Just some quick takeaways. The highest return rate is 138%, and then the lowest at 57%. So we're kind of right there in the middle with our 92%. The only thing that I did want to point out that you will see some mismatch information on is the active participants. So if you look at our active participants in that legislative report, it's this one like that, looks like this. You got to pull it out. It says we have 596 active participants, and I have down only about 300 and something. That's because the State Department of Health website or database did an update on April 21st, and so it changed the way that they calculate that just a little bit. So before, is Erica back? Erica's not back yet. So you will see a little bit of different numbers there. I just wanted to point that out and didn't want you to think that something was off.
This is the change of definition.
Thank you.
Yeah.
Thank you. So just a little bit off there, and then so yeah, I think that's been a question in the past, at least from you, Mike, and maybe John too. Is how do we kind of rate with everybody else? And then lastly is the SSP law. So that is going to talk to you about, you know, what we have to do, what the State Department Health has to do, like provide this legislative update. The only thing that's outdated and not updated is the very, very last section, which says the expiration chapter. It still has it as July 1st, 2022. But as Dr. Bach says, that was extended last week, signed into law by Governor Holcomb to extend to 2026. So that is the only thing that's not updated on there. Any questions?
Yes.
Okay.
We've talked all night about HIV. We haven't talked about Hep C.
Okay.
And I'm assuming they correlate together.
Yeah. Yes.
So I assume our rate of Hep C has gone up quite a bit in our county too. But not only Hep C, what other diseases come with this that may, if we do away with this program, would all come back and swamp our county?
Sure.
I assume if your immune system goes down, you get sick from a lot of other things.
Yeah, so when the HIV outbreak happened, about 98% of people who were also diagnosed with HIV were diagnosed with hepatitis C. Dr. Crosdell, who's on our health board and director of our ER, he can kind of talk about diseases like endocarditis, so that's infection around the heart, and kind of wound care of abscesses.
So what we saw, is it okay if I stay right here?
Yeah.
I'm John Croswell. I'm the emergency department medical director, also a frontline ER physician. What we saw, and my colleague probably has seen the same thing, Dr. Yazel. In 2011, when all this stuff started to hit, I think I was draining skin and soft tissue abscesses at least once a day on shift. I haven't done that in 4 to 6 months. It's not really a miss when that happens, it's just injecting with a dirty needle. The disease burden, you've already heard at length, HIV and hepatitis C. Endocarditis, hospitalization, surgery, ICU care, ongoing need for anticoagulation, that's got to be in the hundreds of thousands of dollars for one case. Devastating spinal cord and brain abscesses that happen as a result of injecting with unclean needles. Lifelong changes for these people. Pulmonary abscesses, mycotic abscesses, fungal abscesses. We don't talk about those things, but the health disease burden for those things is tremendous. The cost is amazing. And unfortunately, this is largely an uninsured population. So we bear that as a public. And in this country, we're compassionate towards people and we offer care even if you can't pay for it. And I hope that continues for the rest of eternity, as long as we're on this earth. But those people aren't turned away. And since the Syringe Services Program came into being, I can tell you that the reduction in those other disease entities, I would like to see a statistic. I don't know if your epidemiologist may have something in the can on that one, but the cost savings on that alone, I would say would be worth it, without the HIV, without the hepatitis C spread. So being on the front line, seeing that every day, back then and seeing it now, hardly ever, it's amazing. And I think that's a direct result of a very successful Syringe Services Program.
I remember 2 years ago when I was here, the CEO of your hospital said you had more people engaged in healthcare coverage, so that more people had been signed up for care, so that when they came to the hospital, they could see a primary care physician, they could come to the hospital and get care, and there was payment for that.
And that was a result of the Syringe Service Program.
Yes.
That's how they were being, integrated into the healthcare system with insurance. And I will certainly echo what Dr. Crosdell said. I happened to be chief of staff at the hospital when the HIV outbreak occurred. And we were very concerned that our resources would be totally depleted just from these cases of endocarditis and abscesses that, patients were being hospitalized for days on end. And for a small community hospital dealing with these patients who were largely uninsured, we were envisioning we could reach a breaking point. And fortunately, when the Syringe Service Program became effective, we saw a dramatic change, as Dr. Crosdell has said.
So it's not just HIV, it's a big picture here we're not always talking about that can be affected by all this. Yeah.
The hepatitis A outbreaks that we had were worse in our communities that didn't have syringe service programs.
Okay.
And, we had an outbreak for over a year in the state from that.
You don't have this one in your chart, but this is HCV reduction, hepatitis C reduction in the counties that have syringe service programs. Almost every other county in Indiana. Indiana is the #1 state for hepatitis C increases, acute hepatitis C increases, and these are the counties with syringe service programs all going down, and you don't want to see that go in the opposite direction. What this shows you in a way that's even more granular than the HIV reduction on a state level, the impact of the syringe service program when you look at the hepatitis C cases coming down.
Okay.
Now, hepatitis C is now curable, correct?
Yes.
So,
Very expensive.
It's a
You gonna help
very
us out with that,
expensive
or
cure. It's a very expensive cure.
yeah.
Yeah. About $40,000.
Prevention's always better than treatment.
Well, and I mean, and again, when people are coming into the program, they're getting tested. So we are actually able to cure people now because of a syringe service program and a touch point, whereas we couldn't before, and they would go out and spread hepatitis C to people for years through shared needles. So again, that touch point is really what we in the public health community appreciate, because it stops HIV, hepatitis, abscesses, it stops overdoses, it stops crime, it stops an array of different sequelae.
Rather than spending $19,000 or maybe $30,000 to treat a hepatitis C case early on, and of course, you wait till you've got the liver cirrhosis and need a liver transplant, that's $500,000.
What's the drug of choice these days?
Meth. And
So
it's
it's back
usually a
to-
mixture of meth and heroin.
It's back to meth.
But we see more meth users.
But I think the price of heroin went up a little bit or something, so. But we're not seeing the prescription pills anymore.
Very, very few, right?
Very
Mostly?
few.
Yeah. But
Yeah.
unfortunately, everything's laced with fentanyl, as you know. So I think that alone has probably contributed to why some of the overdoses, well, probably nationwide, are higher than what they were years ago too.
But Scott County's rate of writing prescription narcotics is higher than the state's average.
That's what I was gonna ask
Yeah.
next.
I
is-
thought that it's 239 or 289 compared to, I'll get it for you, sir. I just
Yeah,
looked
I
at
was
it.
curious about how many prescription opioids we were, I think I've asked you that before in another previous meeting. And if that's
Depending
tracked.
the physicians from Scott County in the room, I think that reflects the prescriptions that come from physicians out of the county as well, Dr. Box, correct?
Yes. They're filled here.
Yeah, the ones that are filled here, not necessarily physicians in the county prescribing those.
But I mean, I know it's probably not public record, but I mean, is there a report or something that says what doctors are prescribing opioids?
PLA sent out, first of all, we started with Medicaid, and we sent out a report card to people that were under Medicaid. Then we got Public Licensing Agency to do that through Inspect, to tell people where they were. Some physicians write more prescriptions than others, not really knowing, just the goodness of their heart.
That's what I'm
They're
saying.
I want to do this. And so when you compare them, like an OBGYN to all of the other OBGYNs, or you compare a surgeon to all the other surgeons, an orthopedist, all of a sudden they see they're kind of outside that limit. So that's the way we've been working with that from an education standpoint. It also helps us, obviously, to find those people that are way out of where they should be.
Yeah, I've seen some of those, so.
So how do we get to the point where they bring you in
Mhm.
for you to give them
I mean, there's I think very few counties that do it that way. Again, the evidence and best practices says that's not the best if you want to really prevent disease in your community. And again, when they get arrested, when they move to a house because that house, they can't stay with that friend anymore or whatever. I don't really know if we'll ever get to that point. But again, I don't really know if we want to, because that's not the best way that studies and data shows us is effective in preventing disease.
And what
Well,
you're
I mean, I
showing,
understand your point on this,
Yes.
but I don't know if you heard me make this comment before, but I own a lawn care business.
Yes.
Outside
Yep.
of Thomas and outside of here.
Yeah.
And it wasn't a couple weeks ago, I hit one with a weed eater and it
Yeah.
went into my pants leg and stuck.
Yeah.
I was not happy.
Yeah, I live in Jennings County, and there's not a syringe exchange program, and I was walking my dog last week and I found one on the side of my road. I picked it up and threw it away in my trash can. But I feel like being in Scott County, I know there's an issue in the community where I technically live at, but I don't really know what's being done about it. At least here, these people are getting help and they know where they need to get help, and if there's a syringe on the ground, at least I know there's a chance that it's clean because there's a syringe service program.
Do we have any cases of people getting HIV from picking up needles or getting stuck with them that way? in
I
our
don't know.
county?
I don't know of any cases that that's
I am
happened.
not aware of any that have been directly attributed to that.
There's, as far as I know, there's never been a transmission of HIV in the United States from a community needle stick, ever.
Okay.
It's a fear, and you don't want it to ever happen, but it is incredibly rare. Rare, and I agree with Dr. Cook. I mean, I've looked at this, and you never want to say never, but we've never seen that reported out. But to your point, you asked a very fair question, and I think it's important to provide just 30 seconds of context. You're at 92% return rate. That's better than the national average. It's above the Indiana average. And so you never see the needles that weren't there. And as the sheriff said earlier, that what you don't want to happen is to create a scenario where you go from 92% to 50% return, or where you think you're getting 100%, but you discourage people from connecting with you, and there's more needles out in the street because they aren't participating in the syringe service program. So I want to go from 92 to 93 to 94 to 95, but we can't let perfect be the enemy of pretty damn good in the process.
And you also don't want people to get to absolutely zero for when they're coming in, because then if they have the urge to use and couldn't get there, then they're gonna reuse rather than have a fresh needle that they could use. So you want them to have maybe 2 or 3 at home and then go in and refill, so that they're not desperate and they're forced to reuse in a situation.
I'm gonna ask you a question. Out of the people that are in the needle exchange program, is there somebody that's a long timer that has never decided to get out of the needle exchange and get into recovery?
There's some people pop in my mind. Yes, the very first day I went on the mobile unit, my first week of work here, they are still in that program.
So they don't have a desire to get out of it at all?
Correct.
I don't know who's
That's
talking.
right.
Tiff.
That's
With a
right.
mask on, I can't see who's moving their
They
mouth.
like it. They want to live like that, and they have no desire to change. But in the meantime, they're safe, they don't have sores all over their arms, they're not having to go to the hospital, they don't have stuff drained out of them.
Absolutely. And they're taking their HIV medications every day. We go pick them up if we need to. We make sure that they get their labs. And anybody that they're around, if those people aren't positive, then we make sure we get them linked to a provider so they can get on PrEP medication. We make sure that they have clean syringes around them. Like it's a job. Like it's a full circle job, and it's like babysitting. But we make sure, and I hate to say that, but it's like babysitting. Who are they? There's this person. Who are they around? We need to make sure everybody around them is safe. We can get them prevention.
And hopefully, if and when the time comes that they do decide, we're still gonna be there. And be
I
able to
get
help
that.
them
It's
get
just
into
frustrating to know that there's other things going on in this world besides drug abuse and for someone to hold somebody's hand and walk them to the trough. I mean, sometimes it's hard to understand because, you know, there's other addictions. There's alcoholism. I mean, those people aren't getting treated as, you know, in drug addiction, because an alcoholic can get picked up on the street for public intoxication. A drug addict can stumble down the street and nobody say a word to him. I mean, you can't touch him.
And they can get picked up for public intoxication too. It happens.
It happens, but I've talked to the prosecutor and it doesn't happen very often,
It
so.
actually happened to me.
But anyway, the point I'm trying to make is, and the flip side of some of this is that if there's a, and just like you said, you when they come in your office, you're sitting there talking face to face with them, trying to convince them to get into recovery.
Yeah.
But sometimes you can't force them to go to recovery.
You can lead a horse to water, you can't make them
But
drink.
if they get arrested then they get into the legal system, and then a judge can tell them, go get help.
The one person that comes to mind when I think of that, I know they've been arrested, gosh.
Well, you can't fix everything, but the point
Yeah,
of it
I'm
is
saying.
that once, sometimes the other system,
yes.
the other system
Yes.
sometimes will force that person
Yes.
into a situation that they have to go get
Yes.
help.
I think-
And they may walk out of recovery and do it, and I know people that have done it.
Yeah, and I think that just goes back to the comment that was made earlier, where everybody's recovery journey is different. Like Phil said, you know, we can walk them to the door, they can go through the program, but
Well, I
they can
get-
go to jail, go
I
through
get
the program.
frustrated. I get-
Yeah.
Do you mind if I just speak on that 1 second? And I know I.
You already had your time.
Mike, look, we had a connection. I think you like me enough where I can talk to you. But what I'm gonna say about that is that I just also told you a few hours, it's going on a few hours ago now, 16 convicted felonies. A judge couldn't tell me to stop using.
Oh, no.
I overdosed 3 different times. The doctors couldn't tell me to stop using. It was actually a first responder that I met and gave me those encouraging hope, that seed that was planted with the first responder that told me I don't have to live like this again, that actually got me into recovery. It wasn't a legal system, the medical system, it was actually someone saw hope in me, right? And that's the spiritual principle we can give away is hope. And so I think that what these girls do, and I'm gonna say this real quick, because a lot of people don't know it, but in 2018 and in 2020, we have 2 recovery coaches of the year that are working in Scott County right now. That's the hope shot, and you have at least 3 recovery coaches that are working on that at the health department with the syringe program. That's your hope shot. There's your hope shot.
So I work actually at a treatment center, and I just wanted to address the whole court system thing. I see people come in every day from probation, from DCS, they're court ordered, they have to come or they're going back to jail or they're not getting their kids, and at least 50% of the time they leave against medical advice because they don't want to stop. They're not ready. They were told to come. It doesn't matter. They're going to go and do what they want to do. It doesn't stop them just because the court says you have to go to treatment.
I understand that. It falls back to personal responsibility, and that until somebody, I can't force somebody to quit. Doctors can't force somebody to quit. Law enforcement can't force somebody to quit. As you said, you know, 8 times or whatever. I know people that have been in recovery and went years and then fell back into that boat again. It's frustrating to see the same people that, you know, that I Narcan, and when they wake up and if they don't hit you, they never say, I need help. I've Narcaned a bunch of people, and I've never had a person say, I need help. Now, if you put handcuffs on them, they need help. But
Well, and to speak on that one, in the recovery community, we always say one thing: you want to find God, go to jail, right? Because that's where your foxhole prayers are. That's the people. I won't know, Judge. I'll never do this again. I need help, officer. Please don't give me that extra charge. I'll go get help, right? But I'm going to say this, and I'm going to say it to you again. I think I said it earlier, but I want to say for the people that are doing the Narcan, thank you for giving me one more chance to do this thing. And even if I didn't get to tell the first responder at that time, I'm telling you, thank you for what you're doing by Narcan somebody, because that one more shot that they can get recovered.
well, sometimes you're exactly right. I mean, but it's frustrating to see it happen time and time again with the same people. So anyway, you got any questions?
I'm here for you. Yeah, questions or?
I guess I'm going to ask if somebody else has got a question
I
or
would maybe
somebody wants to say
Can I
something.
make a suggestion?
What? She said she didn't want to talk.
You know that's a lie.
I do have an answer to your question though, Commissioner.
Okay, what's that?
So Scott County's opioid prescribing rate, and this is truly directly out of InSpec, so it's not prescriptions that are just filled here. This is the rate of the physicians that exist in your community that list their addresses here in InSpec is 252 prescriptions per 1,000, and Indiana's overall rate is 180. So it is definitely higher, and that may be contributing.
So I guess my question as the state health inspector or
Commissioner.
commissioner, or whatever your official title is, madam.
It's not just madam.
So 252 per thousand, and you're saying the average rate is 80?
No, it's 180.
180? So, I guess, does that pop on a radar to the Attorney General or to your office and says?
It's more looking at the individuals that pops on a radar.
Because
We send out report cards, and we know who's outside that, and, you know, that gets looked at.
Okay.
Just a quick question, does MAT count under that as well? Because Weakside County does have a higher rate of people offering MAT, so I didn't know if that's included in
I
that
would have
overall
to,
opiate.
I'm
That's
not
true.
clear on whether that breakdown is included.
That's what I first thought, is it's probably because we have a lot of
I can
people
find
doing
that out.
MAT in the county.
Well, I'm just curious if we still are having the issue on the other side where, we're over prescribing,
I
stuff.
think that Inspect has made a huge difference. It's a huge surveillance issue that we have really helped with.
Okay, all right.
I know there's some other physicians, like Dr. Cook probably wanted to say some things, or.
Yeah, go ahead.
Before I step down, I just want to thank.
Step down, I thought you
Step
were.
up, okay, step up anyway. I just want to thank you for your attention, your concern, your past support. And I just encourage you to review the data that we've provided seriously, and hope that you will come to the conclusion that I have, that Scott County's syringe service program is invaluable to limiting harm to our community and improving health.
Okay, thank you. I'm glad to see you up.
Thank you. I'm glad to be here.
Thanks for having us. This is all kind of eerily similar, seeing faces here again from 2015. Thank you for inviting people out to talk through things. Thank you. I'm going to hand this to you, Randy, if that's okay. This first one is a letter of support from West Virginia healthcare and harm reduction professionals. I think there's close to 50 names on that one. This one is just a general one. There's about 550 people from across the state and across the country. Most of them from within the state, as you can see as you click through there. And then this last thing is just a CDC handout on syringe service programs and why they are effective in reducing crime, reducing the cost to the community, reducing deaths and infectious diseases. And I think it's fantastic that you all want to hear the information, what's really going on in the community, so you can make a good decision. I think that makes perfect sense. And I appreciate the opportunity to come out and do that. And I agree, you can't make somebody change, but you can provide them the opportunity to change. You give them access to services and hope, and allow them to make those healthy choices to change. But just in case you don't know me, I'm Dr. William Cook. I feel like I was called here by God in 2004 to open a practice in Austin, Indiana. So I've been practicing there since 2004. I saw this all coming. I was here in 2015 when it all happened, and we appreciate the partnership with the commissioner in the county to be able to run programs like the syringe service program. It is a partnership across the county.
Do you still prescribe opioids?
We don't do any chronic care or chronic pain management at all. So we work with people in a non-opioid capacity to help them live, if they are in pain, because pain's a real thing, to help them live and function in life without using opioids. So we've taken on other doctors' patients who have chronic prescriptions for opioids and help them wean off of those, and then onto other medications that may be more effective to allow them to function, get them involved with physical therapy. We started a rheumatology clinic so that we can address joint pain without using opioids, for example. So we don't do any chronic pain management at all at the office. Okay. So, you know, I've seen the community at its worst, and I've tried to serve the community as a follower of Christ. And to me, he was a man who defended the weak and he stood with people that the world considered unclean. And that's why I'm proud to stand here today with people who inject drugs, women who have been traumatized, children who have grown up surrounded by chaos and toxic stress, and people who are living with HIV. To me, they're not just patients and they're not just people in need. They're my brothers and sisters in the body of Christ and in the body of our community. Scripture in 1 Corinthians 12 says that we treat the parts of the body that seem less honorable with special honor, so that there should be no division within the body, but that its parts should have equal concern for each other. If one part suffers, then every part suffers. And we've all suffered because our brothers and sisters are suffering in our community. I'm thankful that Dr. Adams is here today. He served our country as Surgeon General. And while he was Surgeon General, he released a report on community health and economic prosperity. And what that report showed very clearly is that a community's economic prosperity depends on its community health. And without every individual in the community having access to health, the entire community struggles to have strong economic prosperity. Scripture also calls us to have sober minds, to test and discern truths, and to come together like we are tonight and reason together. Studying the world around us allows us to discover whether or not what we think is actually fact or not. And unless we put our theories to the test, we're left to make critical life decisions based on what we or the people that influence us think. Sometimes science is counterintuitive. We may think that the answers to a problem are obvious. We may also think that it's reasonable to question solutions that don't seem to make sense at first, like providing syringes to people who are injecting drugs. I was thinking of an example, like if I lived in a community where there was a lot of risk to wildfires, I'd be upset if I saw a man out in the woods setting fires. Wildfires are terrifying. They can quickly spread, threatening the health and the economy of the community. I'd be justified in being upset and outraged. But then he might tell me that he is there to prevent the spread of forest fires through prescribed burns. That's the unsettling paradox and the heart of harm reduction, whether it's wildfires or injecting drug use. Without intentionally setting these safe fires to clear the debris from the forest floor, or replacing unsterile syringes with sterile syringes in the community, the danger remains laying in wait, ready to burst into a quickly spreading wildfire or outbreak. Prescribed burns can be used during outbreaks of wildfires, but fighting fire with fire is the most effective when it's used to prevent those outbreaks in the first place. Prescribed burns are not part of the problem, they're part of the solution. There is one study that I want to point out while I'm up here, and that's that young people with insulin-dependent diabetes, they have access to sterile syringes. And although the incidence of injection drug use among young diabetics is no different than the general population, their incidence of HIV is different. Only 9.8% of insulin diabetics in this study were found to have HIV versus 24.3% in the general population. So 9.8 versus 24.3. No difference in the intensity or the frequency, duration of drug use between the two populations, but a much lower incidence of HIV. And I understand that fear can be a powerful motivator, it really can. But compassion can be even more powerful. I admire people with deep courage, and I've heard it said before that courage is not the absence of fear, that there's no shame in fear or being afraid, but fear cannot rule our decisions or dictate how we treat one another. I don't think of courage as a single virtue. I believe it's actually the form every virtue takes when it matters most, when no one's looking or when everyone's watching. Courage is being tested in conquering fear to do what's right, to take responsibility, and to protect people we may not like or even care about. Courage is demonstrated by people who inject drugs every time they use the syringe service program, because people don't have to use the syringe service program to use drugs. They can use drugs without going there. They choose to. It's inconvenient. It's scary to admit to other people that they need help, but they do it anyway. Because people that use the syringe service program, they're trying to do the right thing. They're trying to take responsibility for their health and the health of their communities, this community. But people can only choose from the options that they have available to them. You have the opportunity to match their courage by simply allowing us to keep what we have, to allow people you represent to be able to have access to this life-affirming program. I'm going to end with 2 Timothy 1:7 that says, God has not given us a spirit of fear, but of power and of love and of a sound mind. So I appreciate your time. Do you have any questions? And Randy, if you ever want to get together and just go through things. Yeah, I was here from 2004 to 2015. I lived through all what happened in 2015. And I've been intimately involved with things from 2015 to now. And if you'd like, just to go over things, I'd be happy to meet with you anytime. And that goes for you, Mike, and John, you as well. I think you know that.
Okay, thank you.
Yeah, you're welcome.
Thank you, Doc.
Go ahead.
I just want to say one thing. I came prepared to give you all the reasons why you need to continue your syringe service programs and all the evidence-based information that goes along with that, but I don't need to do that. Dr. Adams doesn't need to do that. Your community has done that in a way that we could never have said it more eloquently. I also want to say that we got calls from the CDC this week asking if they could come and speak to this. We got calls from the state of Kentucky, from the health department, asking what they could do to engage. And to be honest with you, we told them no, because this is a decision that rests on your shoulders. This is a local decision, and I 100% support that. And you had, as Dr. Cook so eloquently said, the courage, and you had the wisdom, and you had the strength 6 years ago to make the decision to be the first syringe service program in the state of Indiana. You have set the bar, not just for the state of Indiana, but for the entire nation. And I just don't want to see you abandon that.
I'd like to introduce you all to Jerica. She's a friend of mine, and she came to talk about her personal experience living in the community, and I'll let her share her story.
Okay.
Nice.
Get around
Come
there.
up? Okay. Yes.
Hi. First off, I want to thank you guys for just listening. This means a lot to me, but it's not only for me. I'm speaking on behalf of the other people in the community that struggle with addiction. I'm a person in long-term recovery. SSP. In 2000, I'll just start, sorry, I'm nervous. But in 2015, I was diagnosed with HIV when the epidemic hit, right? I was around certain individuals that told me, which it was all based on trust, and they told me that they did not have this disease, right? And I trusted them. So whenever you're out there and you are battling with this disease, right, you go to any lengths necessary to get your next one. So I chose to share a needle. Right? It's my choice. It's nobody else's fault. Addiction was my choice as well. But I shared a needle with this person, and then that person had gave me HIV. So in 2015, when the epidemic hit, right, I was at a location in Austin where the health department was set up, and this was a place where I used my drugs. And I walked into this house that day, and I noticed that everyone around me, they had their heads down, and everyone was crying, right? Because every person in that room that day had tested positive. So I go on and I asked these people if they could test me, and that day they couldn't give me the results because they had ran out of the testing for the 1 minute or however long it takes. So I asked someone, or said they called me in a couple days, and then that's when I found out. During that time, I had a little boy who was 2 months old, and I had overdosed that next evening because there was nothing no hope. There was nothing left inside of me, right? All I wanted to do was die. So I overdosed and I was stat flighted to Louisville that evening. And I woke up with my family all around me the next day, really didn't know what was going on. And I'm going to be completely honest with you, I did not stop using then, right? Because having this diagnosis and not having the support, Scott County didn't have the support back then that it does today, right? Within 3 months of me having my diagnosis, SSP was set up in Austin. And I was able, not only it wasn't just about the syringe exchange, right? I walked in these streets, or on those streets, every single day. Sometimes I didn't have a shower for 3 to 4 days. You know, I was a prostitute, I prostituted. There were several things that I was doing that was not human-like, right? But I did these things. But when I walked into SSP, these people set me up with insurance. They told me that everything was going to be okay, that they planted the seed. They actually had a plane for me to leave to go to California to kind of get a fresh start. And I didn't take those opportunities. But by walking in there and having the support from them that I had, they were willing to listen. And these ladies that are here today that run this program, if you talk to so many people that are in recovery, 90% of the women and men that are in recovery, that's a safe place for them to go. And it's a safe place for them, you know, to just sit down and talk about what they're going through. And they also have the resources for them there. As for me, like I told you guys, I didn't jump right into the recovery, right? I slid back. And I did not jump right into the recovery. But these people that are there today play a huge impact on my recovery today, right? And I'm speaking for those that can't be here. I'm speaking for the homeless person that's sleeping at Austin Park every night that has no one to listen. But they have these ladies and these individuals. That's who I'm speaking for. And I just want to thank you for letting me share a little bit about it. I'm sorry I'm getting emotional. But this program isn't, you know, it's not just about the needle exchange. It's also about people treating you like a human being. Because that's what I needed during that time of my addiction. I needed someone to treat me like a human. And today I do have HIV. But I am married currently to someone who does not have the virus. I have a child who is 17 months old, and she is completely healthy and perfect. And they were the people, though, still to this day, my insurance was set up through them for me to get on that medication that kept my viral load detectable. And still to this day, because of them and because of them working inside of the jails, I still have that same insurance that I had then. So thanks for letting me share.
All right. Wow, I don't know how to top that. Congratulations on your recovery.
Thank you.
Mike, can I say something on that? On piggyback what she said, because I was in the middle of that. And it's not all about, they gave me the resources to do something that I was gonna do regardless of what anybody said, to do it cleanly, and I didn't come out with HIV, but them ladies showed me love every day I walked in there. That's what an addict needs to recover, is to be loved. Because they lose hope. They could lose hope against everything. They would distrust people. Every time I walked into that stage up there, I got fed and I got loved. So that made me want to keep coming back, keep doing what I was doing. And that's the main thing of this program. In order to reach an addict, you got to reach out and love them. But they gave me the resources to do what I was going to do, regardless. Do it clean and do it responsibly. So I think it'd be crazy if y'all got rid of this program. I just want to say.
Hey,
Who
first,
are you?
my name's Brandon George, and I'm the Vice President of Mental Health America of Indiana, a statewide advocacy group. I'm also the Director of Indiana Addictions Issues Coalition. I want to thank you all for having this meeting today. Thank you all for what you've done for the community as a whole, especially in its resilience and recovery for what happened in 2015. I work with a variety of communities, law enforcement, state legislators, Dr. Box, her team, all those other alphabet soup that we talked about. And I wanted to come and convey a couple things. Specifically in Scott County, I work with the sheriff. I work with Thrive, who you've heard from, CEAS, the emergency department, a lot of the doctors that we've talked to. And I really want you all to know that Scott County has become a beacon of hope for the state of Indiana. I work with communities all over. I oversee 20 recovery organizations directly underneath me. The Syringe Service Program, Thrive, the Scott County Partnership, Centerstone, Life Springs, the Sheriff Department, all these groups work collectively as a stakeholder group and is held up as an example. The idea of syringe services to me really used to make me cringe. I too am a person actually in recovery, and the idea of giving somebody a syringe just absolutely made me cringe. But as the sheriff mentioned earlier, after learning, doing some research and really learning what to do, after hearing from people that just gave testimony on the way that it's actually impacted their lives, my attitude has changed. And it's not just me. The state, the leadership, the legislators, their attitudes have changed as well. And I really understand this used to be a political hot potato. It was political quicksand. The idea of even opening one of these could get you not elected. It was a terrible, terrible topic for politicians.
It's against the law in the
Yeah,
beginning.
but even afterwards, though. And people wonder why there's only 10. The reason why there's only 10 is because it's not health officials making the decisions. Often it's politicians making the decisions.
Well, that's a fact. I mean, we're elected to.
Yeah, absolutely, and you have to do so through the legislature. I understand that. It's not blame, but it is. If it was up to health officials, you've heard from a bunch of them, this conversation really probably wouldn't even be happening. And so this year, the state, having regularly advanced these in 2-year cycles, took the step this year to extend it by 5 years that was mentioned. But I want to give you a little insight into that. The Senate Health Committee voted unanimously on this. Not one person from one district voted against it. When it got to the health side, the Senate Public Health Committee, again, completely unanimous. When it went to the full House, in our State House, the vote was 93-1. You can't get 93.
Can I ask who the one was?
No.
I would like to know, really.
Yeah.
Can I ask if that was attached to another bill?
Yeah, there's always things always pushed together.
What bill was it attached
Health
to?
Department.
It was a part of our general health department bill. And it was, we asked for a 10-year extension, I'll be honest with you. And, you know, they were not comfortable with that, so we negotiated that. And
Okay. Well,
the bottom line is because it doesn't do anything to your ability at the local level
To govern.
make these decisions and govern this.
But overwhelmingly passed.
Overwhelmingly, and you can't get 93 politicians to agree on if the sky's blue, honestly. And so, but the same is true nationally. The past Surgeon General Jerome Adams just mentioned that this is not this political divisive. The Trump administration fully supported these. This isn't a red or a blue issue, or Republicans are against this, or Democrats are against this. This is not a crazy left progressive agenda. This is something that has been embraced by both parties, both in our state and politically. And then people ask a lot, why do we still need to do this? And many people legitimately, like, we don't have an HIV problem anymore. Why do we need to continue to do this? And the comparisons I want to give honestly, the reason we need to do this is because it works. And so if crime's down in Scott County, we don't call the sheriff in here and get rid of his budget. We don't say that we should shut it down. We would encourage him. We'd say, good job, Sheriff. We would say that we want you to keep doing what you're doing. You're doing a great job. Clearly, these interventions you put into place are having an effect in our community. And that's exactly what the Syringe Service Program in Scott County does. It's having a huge impact around so. And The West Virginia case was just mentioned. We don't have to wonder what will happen if we get rid of a syringe service program. It just happened in real life, and the outcome was very, very negative. I hope you listened to that Brown study about what may happen directly in Scott County, but we don't have to play the what ifs. We know exactly what happened in West Virginia. And then just in general, like one of the things I want to promote, we really, let's listen to our county health department leadership. Let our healthcare folks continue to provide healthcare services. Let's stay on the right track. Scott County has talked about a lot these days in a very, very positive way. I think that we should keep it that way. It's not broken. Let's not have the reporters that were here yesterday and today write articles again like they did in 2015. Let's have them write positive articles about how great Scott County is. But most importantly, let's not have another HIV outbreak. Thank you guys very much.
I had a question to you, Dr. Box. Why doesn't the governor make this statewide mandate?
So.
I got a big question about that.
Yeah. So here's what I'm gonna say to you. The governor, although many people may not believe it after our past 14 months with the pandemic, is truly a believer in local control and your ability to rule yourselves and to make your decisions. And in all honesty, not every community would embrace this the way your community has. And initially when this started in 15, I would venture to guess, even though I wasn't here, not everyone in your community did embrace this in this
You're
way.
right.
Still don't.
And I'm sure they still don't. They must not have people in their family who have suffered from this.
I think they do, but I also think that, I don't know about that either. But I mean, and I'm gonna be honest here. I mean, everybody thinks I'm the Debbie Downer here, but I had a nephew hung himself because over this drugs. So it's affected my family as well. So, you know, so don't think that it's not touched my family. I mean, I went and found him. So my question again is if the governor is so bent on this being the greatest thing since sliced bread, why doesn't he mandate it statewide or try to?
Again, I think that the situation is not every single county needs this, okay? I will tell you though that substance use disorder is an epidemic. And when we did our Title V assessment for the state of Indiana, the two things that our families asked for were more substance use disorder support, and I'm not just talking injecting IV drugs, I'm talking alcohol and other things, and more mental health support, and they go hand in hand. And so I can't speak directly for the governor on this, but I can say that what he supports is our state legislators allowing you at the local community level to have the ability to make these critical decisions for your own communities.
Okay.
Now, I'm not hearing you say he's against it.
Oh, he's not against it.
Yeah.
No.
Yeah.
And if I can just add to that, this is a very unique situation in Scott County because in most other counties in Indiana, HIV is transmitted from sexual contact. And so when you have people using substances in other counties, you don't have nearly as many people who are HIV positive who are injection substance users. So it's much more likely if you share equipment in Scott County with somebody, you're going to be sharing with somebody that has HIV, which is not the case in most Indiana counties.
And you have that on a record of that information that you're saying that in Gary, Indiana, they're not sharing needles?
It's not that they're not sharing needles, it's just that when the number of people living with HIV, most of them got it because they were having unprotected sex with other people. And so that is not the case in Scott County. And I'm from Evansville. I started working in HIV in 2004 and in the southern 11 counties of Indiana down there. And when I heard that had moved up to Indianapolis in 2011, I was the vice president of the largest AIDS service organization, and the press showed up in our lobby saying there were 24 cases down here. And I said, that's crazy, unbelievable. I mean, I had no idea that something like that could happen. And so this has just been a huge learning experience, and that's why you know, when you talk about it, we would love, Kentucky has over 70 SSPs, and we've got 9. And man, I'm jealous of them. I wish we had more because we could really use them. But, you know, particularly in Scott County, that's why you can't overlay it on every other community, is because it's just such a unique thing that happened here. And so that's, you know, like Dr. Black said, it's not the right medicine for every group, but it would help us out a whole heck of a lot with hepatitis C.
Okay.
But
Another point is that a lot of health departments aren't fortunate enough to have the big staff, and we have to get grant funding to, you know what I mean, staff it now. So it's a lot of work. Putting this on is a lot of work. So like when you have to do that for all 92 counties, like some health departments just don't have the capabilities to do that. And I think Brandon mentioned this, like if it was a decision just strictly health officials, I think maybe you would have an uptick of people who would want to have a syringe service program instead of going through their local executive body.
Well, I understand what you're saying, but I'll disagree, but also disagree with the governor about vetoing the bill that kind of limits his powers a little bit too, because I think when health decisions are made in each county, I think the executive board of that county knows or should be able to have some sort of input in that decision instead of having a person, and I'm talking about Dr. Rogers, that's appointed by the commissioners. He's going to tell us what we're going to do, and we don't have a recourse, and that's why, you know, when the government...
In the past 14 months, the counties where I saw that work the best, and it was probably 85–90% of the time, that's exactly what happened. The local public health officer worked with their county commissioners and many times the mayors and the hospitals, you know, the CMOs of the hospitals, to make decisions that were best for the community.
We didn't have, I'll honestly say, we didn't have that kind of problem, but I didn't like to have that situation where if he says he's gonna do this, we didn't have anything to say. We couldn't do anything. So I'm gonna tell you, I called my senator last fall and asked him to try to, you know, go to bat for the commissioners, and I know the Association of Commissioners also did that and tried to get them to pass a bill, which they did, but it's kind of got watered down as most things do. So, anybody else got something else? Miss Robbins.
I'm kind of in a unique situation, as a lot of you know. Jean Robbins. I moved here when I married my husband, Kelly Robbins, 42 years ago. Started off as the WIC director, been involved in public health for 42 years.
And you were a former commissioner.
Yes. I learned a lot during that 10
Life
months.
of a former commissioner.
It's so good seeing you. Thank you. I felt like it was almost a reunion. I mean, but there's such a bond with the people that were here when this first started. Okay, I'm not going to get emotional. I never got emotional in those 10 months I was a commissioner, right?
That's right.
Okay, I thought what I'd first do, because in public health, you're always getting lectured about, well, how does this affect the economy? And serving on this board, I realized economic development always has to be looked at no matter what's going on in the world. And so I served as the county commissioner's economic development representative for the last 3 years. And we contracted out with One Southern Indiana, who I think have been doing a great job over the last less than a year. Anyways, they connected me with the Kelley School of Business. And these are just some data for you reflecting everything that's happened in the last 5 years has not affected the local economy negatively, okay? And these are the indicators they suggested that we go ahead and review. I'm not going to go over them all, but you can see. The only data I had for 2020 was unemployment, but I went ahead and put the U.S. averages in there so you can kind of see how we're doing. As I said, I'm trying not to be emotional about this. I reached out to Matt Hall, who also works for One Southern Indiana. He's been recruiting for Scott County, trying to get interested employers here for the last several months. And I asked him, has anybody in all your years, he's been doing economic recruiting for about 32 years, has anybody ever talked to you about a needle exchange in a community? That's a screening question to locate in a community. He says, no one ever talks to me about a needle exchange. So I told him a little bit about how in Scott County, we're prepared, we are proactive. Anybody that settles in here, if they have employees whose family members or the employee is experiencing problems with addiction, We're all ready for them. Not many communities can say that. You can view that as a positive. We're trying to be proactive in planning for the future. He said the only question he has ever gotten about any type of addiction is if there's a smoking ban or not in the community. That seems to be where the real interest in, that they don't view anything negative about having a needle exchange. So I thought that was important that you hear that. 6 years ago, when all this started, none of you guys were here sitting in those chairs. We had all different players. For all different reasons, we have new faces now. Mike, I thoroughly enjoyed working with you. We didn't agree on everything. But we learned how to work together. And I really earned a respect for all of the elected officials because you're no longer a certain party once you get in those chairs. You're all about what's here for the community. And I think what I realized too was a very humbling experience because there was so much I didn't know. And you come in with your expertise, with what, your world that you had lived all these years. Each of you do. I just happen to have experience in public health. I can't say we really ran into a whole bunch over the 10 months, but the reason that I wanted to continue on this emphasis was when my husband, who was here originally as a county commissioner, had to deal with this along with his two comrades. None of them knew anything about public health. And you know, he's asking me all these questions. I knew nothing about needle exchanges. When he first talked to me about this, I'm like, this is crazy. Why would you give somebody a needle? The same thing you've heard over and over. And then when you researched it, you took on that responsibility of finding out the facts. You're like, this is really a no-brainer. The beauty of this community, and others have pointed it out, is we take care of our neighbors here. Each one of you will help your neighbor. You never even hesitate. And you do that without judgment. And that's how we've got to look at this needle exchange, because it makes such a difference. And what we do in Scott County is we develop relationships with people that we help. And that's where the trust factor comes in. You can't have a recovery program without a needle exchange, because the trust develops during that needle exchange experience. And you've had people testify to that. You have to have both. They work hand in hand to be effective. When my husband 3 years ago suddenly was facing death within a 3-week time, he died. We had no forewarning. What do you think he's worrying about in the hospital? The upcoming vote for the needle exchange, okay? That's how passionate he was about it. And he didn't know anything about a needle exchange, but he was open to listening to the experts because he was not an expert. And that's what you have to do as a commissioner. You have to be open to listening to the experts. You also owe it to your constituents to listen to them, and you're doing a fine job of that too. But you have to also sometimes make unpopular decisions if it's right for the community. And so far, it looks like it's right for the community. I understand the concern about finding stray needles, you know, on the ground and all that type of thing, but it doesn't sound like it's a major problem as it used to be. So I didn't have an answer from my husband at the time. What are we going to do about the needle exchange? And believe me, we never talked about, well, Jean, maybe you should go ahead and see if you can be appointed in my spot when I die. It was within a couple weeks later that some people approached me and said, well, you've got some experience in public health. Why don't you see if you can get appointed? Well, it happened, okay? I sat in your chair 3 years ago. I know exactly what you're going through. You owe it to the community to listen to them, but you also owe it to the experts. And one way I'm looking at it right now, because believe me, I've been going over and over in my mind, how am I going to talk to you guys about this? County commissioners are always focused on infrastructure, right? I learned more about culverts. I had to get boots on and wade in water. Where water was draining, I had no idea what I was looking at, okay? I had to do all this research. I had to talk to you guys. I had to talk to people in different departments. I was on a big learning curve, and I admitted it. When there is a hole in a road that needs some patching, oh my God, do you hear about it as a county commissioner? That's like a top priority in the community. Once you patch it, do you have constituents that say, okay, what's going to happen now? We don't need to put any more money in it. You patch my road, that's all I care about.
They usually tell us we patched it wrong.
That's true. You're right. You're right. Well, you need to look at the needle exchange as public health infrastructure. It's the foundation for continuing strong services that make a difference in this community. And like Dr. Adams says, the way we handle it here is unique to the rest of the country and unique to the rest of the world, because we don't have judgment when people walk in. We're just there to help them. So it's so important we continue with that. And you don't suddenly say, well, HIV is gone. How much longer do we have to have it? You don't do that with roads, do you, when the road is patched? you've got to look at the infrastructure of public health the same way. And one additional great thing that happened as a result of the unfortunate outbreak, our public health department services have expanded so dramatically since 2015. They have a larger building, they have so much more staff. I mean, we've handled COVID beautifully because we have a wonderful health department that you, the commissioners, have supported totally. So once again, I want to stress, you need to look at this as infrastructure. You can't look at it as this is some unique situation and we just want to pretend it's not here, because some positive things have happened, especially the strong relationships that you have backed up with the health department developing with those that are benefiting from the services. Thank you very much.
Mike, Randy, if I could just address you from here, I don't say much and won't take much of your time. I'm a pastor in Austin, and I'm at the Church of the New Covenant. I've been there about 5 years. I'm in the trenches there. I'm intimidated by the intelligence in the room. I'm not a real smart man, but I know a good thing when it works. I've always been one that if something works, why change it? And this program is working. And, you know, as far as the ladies go over there, there's a tremendous crew. I always have a saying, people don't want to know what you know until they know how much you care. And these ladies implement care in a genuine way. Not only that, people will come to them, they'll reach out to me like, I got this prospect here, you want to pick him up on him? And I'll be like, oh yeah, because I'm all about making disciples. And so, you know, outside looking in, anything to do with addiction's ugly. Let's just be blunt. But inside, there's a beauty and a beautiful thing, and it's bringing beauty out of the ashes and darkness there. And so you guys will be making a very big mistake if it's gone away. And I know that, and I can tell you with great confidence because I'm right there on Rural Street in Austin, and I'm right in the trenches. And I can promise you, with a man of experience over the last 5 years watching this work, it is working. I like to close with I like to pray over the situation because I'm a pastor. So you guys mind if I pray? Let's pray over this situation. Dear Heavenly Father God, Lord, I'm so grateful, Lord, for standing up and the opportunity to pray for this. You have 3 wise men, great men of great counsel, Lord, in great positions. And Lord God, I pray, Lord, that you affect their hearts and their minds, and give them the right decision. Let the decision be made from the heavenly realms, Lord. But Lord God, let them know the benefits and just the positiveness, Lord, Lord God, and just the trusting the women there and the men that's involved with it, God. But I pray, Lord, for your will to be done in this situation. In Jesus' name, amen. Thank you for your time.
Okay. Quickly, thanks everyone for for all the information, but let me speak of the reality of today in Scott County, right? First of all, let me rewind a little bit back until 2015, right? Remember that sign that they wheeled out that was lit up that said, warning, HIV outbreak, right? Not good for the community. Not good for, you know, anything, right? But let me speak about this life-saving program that has helped so many people. And let me remind you, back in 2015, there was about 15 people living with HIV in Scott County. Fast forward to 6 years later, the prevalency rate here is extremely high, like Africa numbers. I'm talking about 229 people in this small community. So look, drugs are very, very accessible today still. I can still go get high if I want to. But today I can also go get a clean syringe if I want to. I'm a person in long-term recovery. I'm probably not going to get high when I leave here. You know what I mean? But I'm also a person that injected drugs 6 years ago. I'm a person that works at one of the ASOs Jeremy spoke about. I work with thousands of people living with HIV today. Thousands of people. People don't die of HIV. You know what I mean? Today, we're not in the 80s no more, folks. You know what I mean? But there is a huge amount of stigma. And when people, you know, everyone's not HIV positive that comes into the syringe program. And the ones that do come in are probably not going to be HIV positive when they leave. So, you know, our whole goal is prevention, right? Healthy lifestyle. So we can access insurance when we get there, health care, treatment, a better way of life. You know, so today's reality is, you know, we're in a better place than we was 6 years ago. And a huge part of it is because the SSP program and Dr. Cook and the CDC that came in, and I'm talking about I'll say this and I'll shut up, right? Scott County was fueled by the biggest HIV epidemic. It was the biggest fueled IV drug epidemic in the history of the United States, right? We got one stoplight in Austin. John, you work on that. We need two now, right? I'm talking about, and it didn't all happen in Austin, man. But someone that, and one more thing, right? And some of these treatment programs are free, right? The Salvation Army is free. You know, that's where my journey began. But if you do want to seek treatment, there's many others.
Thank you. Let me say, just, I don't know if I'll even bring this up or not, but there's a few in here that I've arrested in my life. And you're one of them. And you're one of them.
You also was my basketball coach.
I was. And I hope that didn't cause a problem.
Absolutely not.
But I gotta tell you, and I mean this sincerely, 10 years ago, I didn't think you'd be alive. You were on such a downward trend. Just having you in this room is a miracle. And you're not the only one in this room. I know others that spoke tonight. But because of what's going on in this room tonight, you're here and you're talking for encouragement.
Amen.
So I congratulate you for what you've done. You've made our community a better place.
I will be quick. I won't be like some. But, you know, what the needle exchange program not only does, you know, you look at it, just hands out needles, you know, they bridge that gap between the addict and treatment and recovery. And because, you know, you want to talk about the one addict that doesn't want out, I want to know the numbers of the addicts that they got into treatment that is in recovery today, you know. It's like amen to that. They really are out there. They love the addict until they can love themselves. I was in addiction for 40 years, you know. I've been clean for two and a half years. So, you know, and it's just amazing, you know, but they love that person and they don't ever give up on that person. Yeah, they keep them coming back and they keep engaged with them and they educate them on what their options are, you know, and they get them into treatment, you know, to where that they can get out of there. And then they can reach back and they can help the next person and say, hey, what about that needle exchange program? Work for me, go try it out. So, I mean, it's amazing, you know, and I love it.
Anybody else got something?
I just want to say to you, Commissioner, you said you were a downer. I disagree. I actually disagree. And one of the most important things is for communities to have a conversation about what's going on. And today was just tremendous. I mean, this was food for my soul to hear all of you all talk about this. And I don't want to presume anything, but I believe in my heart you all will make a decision that reflects what you heard in this room today. And that's why you all need to continue to have this conversation. So you're not a downer. You're asking questions that people in the community have. Yeah. And they need those questions answered, and I hope you got the questions answered.
But you're also listening.
You're right, you're right, because, you know, the ones that are against the needle exchange aren't gonna come out and talk. But they call me, they call Randy, I pass them on the street, you know, there's other interactions. So there are people out there that don't want this program. They feel like it's detrimental to the community, as, you know, as far as growing the community. So they have their reasonings too, and like I said, but like I said, I can't stress it enough that I'm not a person that's sitting at home and people are overdosing and I don't know about it. I mean, I can guarantee I've been on more overdoses than anybody in this room. And
and I've Narcaned you before.
I didn't say I need help, thank you. I may have not wanted John to arrest me, that was my own.
Actually, I told a story
thank
about you not too long ago,
Yes.
about you walking out of the ER, so. But, again, I'm glad to see you're here. That's why I say, very seldom do you ever see a person say, I need help. And it's aggravating it for a first responder to Narcan somebody, and this is one of the things that I really struggle with, is that there's no accountability, because if you overdose, I'm sorry, Tony, I keep
No,
pointing
you're good,
at
that's
you,
only
but
5 times, if you save me 5 of them.
well,
you know?
probably,
Thank you,
but
keep Narcan.
but the point of it is that they walk out of the ER. There's nothing happens. I mean, nothing happens. You walked out of the ER, pulled your IV out, and walked down 31. I mean, so the issue is that I don't know how do you get to somebody to say enough's enough? I mean, I've been in the worst of worst situations. Like I said, lost one last Tuesday. Was doing CPR, did the Narcan. It was you couldn't save him. So
Let me say this, you can never force someone to hear a message, but never underestimate the power of planting a seed.
I get that.
You know what I
I
mean?
get that. I mean, I'm not going to stop Narcan
I
somebody.
know
So
you won't.
Well, you said nothing happens, but I argue with that politely with you, sir, because 6 years ago, nothing would have happened when they left. Now, the next day, they may go into the SSP and get a sandwich, or get some clean needles, and have an opportunity to continue that connection. And so, and you said that there are people out in the community. I'll tell you, I don't know if Marshall McLean's still back there, but 6 years ago, this room was filled with just as many people who were against the syringe service program. So this education that you're helping the community engage in is changing that stigma. It's slowly starting to change those minds. So thank you, and thank you to the commissioners for having this conversation.
Anybody got anything else they want to talk about?
I just want to add one more thing. I'm not going to do any statistics, but I just want you all to know we're not wandering around in the dark. My name's Jeremy Turner. I'm the division director for HIV, STD, and hepatitis. And we just launched the new plan. I know that there's a little other public health thing called COVID-19 everybody's talking about, but we launched our statewide Ending the HIV and Hepatitis Epidemic Plan. We talked about President Trump in 2019 launching the Plan for America. Phase 1 only included Indianapolis and Marion County, but under Dr. Box's leadership, she wanted to make sure that we had a statewide plan. And so we've got a plan for all Hoosiers, and it's a 10-year strategy. SSPs play a big role in the prevention part of things, but we want you all to come along with us. We don't want to leave Scott County behind as we see improvements in other parts of the state. We already talked about why SSPs are so important for this community particularly. But it is something we're going to get there. We're already seeing improvement year over year. And so this is not going to be the same kind of public health crisis it has been in the past. We're going to continue to make progress, and this is a big, important part of it.
Okay, appreciate it.
Can we get a 2 or 3 year renewal? I drove all the way down here.
I just got one question. Do you have a job?
That's cold, Commissioner. That's cold.
I wish you still had a job. I'll just put that away. At this point, do you have something else?
No, it just, thank you.
Okay.
Thank you for sitting here and listening
Well,
so much. Thank you, thank you.
I appreciate everybody's input. I mean, like I said, you got to hear the information, to absorb it, to come up with a solution or what you feel comfortable with. Somebody said it's not an easy decision one way or the other. So that's why people elected people to office to try to represent them as best they can, and quite honestly, sometimes I'm going to make a decision that everybody in this room is not going to like, or somebody outside this room is not going to like, and I'm sure that's happened. So, or these guys, because it takes two to do something, and hopefully we lean on the side of the best thing most of the time, so. With that, I'm gonna ask Tammy to shut our little owl off here and if I'm sure the rest of you don't wanna hear the rest of this meeting. And
Okay, we're on.
Andrew here, dark fiber, that sounds like something bad.
It's actually really, really good.
Yeah, that well, by the way, Mike.
Huh?
You handle the meeting well.
Yeah. Hopefully my brain can keep up these numbers now.
Thanks, sir.
Thanks, sir.
All right, I want to talk to you guys about a dark fiber project that I want to work with the city for about. So I know you guys know what fiber is. Dark fiber is pretty much fiber that is not lit from the provider. So this project, what's going to happen is we take the highway departments, health departments, and EMS's internet service away from the city. The city gives us a bunch of bandwidth here at our main circuit, and the city runs fiber from the buildings straight back here to the main switch. So that eliminates from firewall to firewall any VPN traffic for phones, servers, backups. That's all gone. Everything could be hosted here at one location, then the buildings just feed off of fiber back and forth. So right now the first page on here is just to show you kind of a little bit of a price difference in speeds.
So right now, we're not on any kind of fiber.
Yes, we are fiber. Every business is on fiber, but it's lit by the city. The city's providing them internet. So any kind of communications from the buildings to back here for backup purposes is limited to, say, the county highways 100 megs down by 20 megs up. So when their backups are pushing here, they can only travel at 20 megabits per second, which is slow. Backups take a long time through the night. When they go dark fiber, it's 10 gigabits. Hold on, I'm losing my brain here. Yeah, 10 gigs a second from the building to here. Way faster, way super faster.
I mean, do they have to do anything physically with our system right now?
Nope. City runs fiber from point A to point B. I provide the switches and the fiber transceivers, and that's it. Right now, for the highway department, health department, EMS, and the courthouse main circuit, it's right at $1,000 a month. To do this project, you're adding $576 a month.
And we're speeding the whole system up.
Correct. So the county highway, health, and EMS goes from the speeds that's on the chart to a gig down and 200 up. That we will all share.
So with that, does that have anything to do with the internet?
So right now the city's providing internet. So the city's providing the internet. I'm repeating myself, sorry. When we go dark fiber, the internet comes from the city to the main switch, then I push the internet back out to the other buildings. It's pretty much the easiest thing to think about it. So you know that at home you have your router. You usually got just 4 ports open for wired Ethernet stuff. It's pretty much me throwing miles of Ethernet from here to the building. There's no internet or no VPNs or anything between. It's just hooking their system up right to mine. So we've got LAN speeds instead of VPNs and going through the internet and back down to them.
So what you're saying is okay, I get it.
It's a direct connection.
Instead of a bunch of them going this way, we're having one coming in and you're separating it.
Correct.
Okay.
So pretty much I'm getting the bandwidth from the city, then we're being the internet provider back out to the other buildings.
Okay. So I guess I see this new 5-year contract looks like it's
Correct.
going to jump about $570 or $577
Per year?
Per month. I did talk to Teresa, and with the is it the COVID CARE Act grant? Is that what it's called?
Are you talking about the new money that's?
Yes.
That's the ARPA.
Gotcha.
That's American.
One of the categories is broadband infrastructure. So it can be covered by the grant.
Also with money that we're going to be receiving, actually, it should have already been in the state right now through the $1.9 trillion, federal package. Broadband was one of the contributes, I guess, on that bill. So
This is a really good project. The thing is too, is like, I'm gonna ask for $20,000 from the council with your guys' approval. $20,000 will be matched with the grant. Then after that, I can budget this in. I can actually cut this year's budget back quite a bit next year and just pay for this.
So I guess, give me the pros, what's the biggest benefit to the county or to county government?
The biggest benefit, so right now our phone system, our master phone system's here in the courthouse. At the highway, EMS, and health department, they have their own phone system that talks back to the main one here. With a office-to-office VPN, you can have hiccups in between the two connections. Say the handshake, it checks itself about every few seconds. Say the city's having problems with their internet because the health department, that fiber could probably run to one of the city switches somewhere, bounce to another switch, bounce to their main node.
You can't do that, sorry. You can pull it shut, you just can't shut it.
You can't shut it completely.
Just pull it closed.
So
you can't shut it, but you can pull it close. No, there you go. Just leave it open. Yeah. Thank you. You guys from the press ought to know this stuff.
So right now there's so many hops and there is so many hardware failures in between. With a direct fiber connection from here to there, there's nothing in between to fail unless the fiber gets cut or something horrible happens. So right now also backups. Let me get back to the phone system. When anything fails, your phone call's gonna get jittery, it's gonna sound like crap. If not, just completely hang up, phone system goes out. Switching to dark fiber, that phone system has nothing in between except going from there back to here. It's talking land speed to our PBX. There's no dropouts, no anything. Another big benefit too is backups. So each department has their own servers on site. That's a piece of hardware that can fail anytime. We can take all those servers away, make virtual servers here, then their equipment just talks back here for their data needs. Everything can be backed up here locally, then off-site, then also with a 10 gigabit backbone from here to the other buildings. Say if I wanted to put another file server at a EMS and the health department and the highway, backups can run here, then shoot there, shoot to the other buildings, shoot to the other building, and just do a complete ring with off-site backups throughout the whole county.
As far as this money, is each of the departments that he's talking about, do they have this in their budget already?
I will be taking their money away from them.
So you're gonna take it and you're going to put it in your budget?
Correct.
Okay.
So
you'll centralize the
yes, centralize it.
We'll be doing that this year?
We can't do it this year.
Yeah,
With what I talked with Teresa, there's really no good way to rip funds away from other entities' budgets to dump in mine.
Right. So when are you gonna start on this? That's the reason I'm saying if you're gonna take.
Is this a 22 thing? Is this like something that?
No, this is going to be happening this year if we get it going. Oh, absolutely.
And then.
Yeah, budget issues.
For next year, I will be able to cut my budget back and be able to put this in my budget.
So you'll absorb it?
Correct. I will absorb it. And also planning on to absorb all the other departments' phone bills in mine also.
I think it's a good idea,
So the other departments won't have an internet bill probably. I'm really hoping if we get this approved with the council and you guys, couple or few months, because the city is gonna be running bucket trucks from each building fiber all the way back, and that's gonna take a little bit of manpower and work, so.
So you got on, you were talking, you got on here highway, health, EMS, courthouse. Is Jeff part of the courthouse?
Yes.
Okay.
Yes, the main circuit goes from here to dispatch, corrections, and jail.
Okay, all right.
So kind of, also that's another factor, it's really not fair for a few departments to be paying for their internet too when other departments are not.
Yeah.
So I'm gonna absorb everything, and we'll be the central hub, then we'll be able to say, hey, you know.
And you're gonna budget that, when you put it in your budget, when it goes to the council.
Yep.
Questions?
Will we have to purchase all new computers to
Nope.
take advantage of this?
No, we'll actually save money because we're getting rid of physical hardware that could be a point of failure. So we'll be getting rid of, because also the phone systems at the other buildings, we're gonna be ripping those out too, and we'll be going to complete IP phones. So there won't be.
What's an IP phone?
So if like at home you just got, like I say, a good old phone from Frontier, just a copper pair, IP phone runs through network, Ethernet. So it'll just run through your network and come back to the PBX, the phone system.
Clear as mud.
So instead of instead of a pair of copper, you got 4 pairs of copper. There you go.
Does that slow down your internet?
VoIP, like IP phones?
Yes.
No. One, you can pretty much say one phone call is 1 megabit per second, taking up your bandwidth. So if you think about it, if we're running from the highway to here, and it's going to be all 10 gig network back to the PBS, so that's 10,000 megabits per second, and one phone takes 1 megabit per second.
10,000 phone calls.
Yes, if you really wanted to.
I would like to say something and tell engineer, but to be honest with you, I don't know what you're talking about. But my wife behind you, she's the expert. She had a question.
We switched to voice over IP at work, and we have never had the same sound quality. Now, you may end up with better phones because we're kind of cheapskates, but that was the only problem we had with it.
If you switch carriers, phone carriers, you probably went from copper to a SIP carrier IP phones. Yeah. So the big difference in SIP trunking and just SIP. SIP trunking is where you have a provider on the internet provide you a phone data path into your PBX. That's SIP trunking. What's bad is if you really don't have good networking equipment, or if the internet goes out, or say the internet's just not running good that day, phone quality is going to get bad. Then there's a SIP, just a SIP voice. That's just parking a phone, plugging it in your network, and it connects directly out to the cloud for service. Which there's other things in the way, something can happen, internet can get bad, network congestion. What we have here is a copper PRI still. So the phone data paths is still going copper back through Frontier through copper straight to their hub, just right down the road. So with a PRI, there is true dedicated bandwidth, no congestion, and probably 99.99% uptime. So your call quality will always be excellent.
Andrew, if I'm hearing you right, if we vote this in, you won't have to go to the council.
I will have to.
You will have to.
Correct.
Because you're talking about taking money from different departments and this and that.
Yeah, this year I'm gonna be asking for $20,000 for the complete project.
Okay.
Then next year, I'm going to budget this in my
Even though
budget.
we may pass it, it ain't in until they cooperate.
Correct.
If they do. Okay.
So, and like I said, it is a 5-year contract, 5 years. It has a nice little run, but I know for a fact, Spectrum, Frontier, Verizon, any other fiber service is going to way more than quadruple. I don't know the word for 8 times or 10 times. It's probably more. Yeah, it's going to be more than that. And plus, you've got the city coming out here running fiber for us. If we have a big dog come out here to run miles of fiber, it's going to be hundreds of thousands of dollars.
I'd rather stay within the
Yeah.
county. So I'll entertain a motion if somebody wants to do that.
And I'll second that.
I'll make that unanimous, so, good luck with the council.
So I think what I'll do is, hopefully after getting their approval, I'll come back to one of you guys and just get the contract signed. Is that okay?
Yep.
Awesome.
All right. As far as I'm concerned, unless you need all three of us. We need all three of us.
Just need
signed?
president.
Okay, yeah, just no. That's
All
awesome.
right.
As long as he's okay with it.
Appreciate it, thank
Okay,
you.
thank you guys.
911 EMA. Chair, Elise, I got something for you, actually. Before I forget about it. WMPI's tower. Did we go through with that lease?
I sent it to Houston's office and have not heard back.
And I
Okay.
heard back, I apologize. I have a few suggestions and corrections that I've got to get with you on. He has some suggestions for that lease agreement that we had concerns about, which we and I haven't had time to sit down and discuss.
Well, I had a phone call from I had a phone call that says there was an issue with the property, the new property owners and the towers, so you might verify that it's.
I was gonna hold off anyway, because the sheriff's wanting to move that tower out there. And I thought about seeing if it was sufficient enough, if we removed it from over there and put it somewhere else. Save us some money. I'm gonna have to check into it.
That's not a very tall tower over here.
Well,
though.
150, it'd be 150 feet less than what we was gonna do out there.
Yeah. I'm
Which is-
not opposed to doing the radio tower. I just wanted to make sure that the property owner and the person we're going to lease it from is in good standings, so.
Understand?
So
We'll
go
look
ahead.
into it.
It's yours.
The update is basically the next generation 911 GIS. I've been working with WTH people. We are in the process of cleaning up some ESN issues. And that's the ESN is when they call 911, it tells you what police, fire, and EMS would respond to that location. And some of the issues that I've seen and been dealing with is like where Scottsburg and Austin have expanded and the old ESN wasn't taken out. So, or they were both still on the mapping system. So we're having to go in and verify if, which one's correct.
So
hopefully in the next few weeks, we'll start doing some training on that and have it rolled out.
Also, and Greg did this for me before he left, but I'd like for you to reach out to your providers and see what, if that place burnt down over there, what a new system, boards, motherboards, whatever it takes to run over there. I want a price on what it costs for you to have
computer equipment.
all brand new stuff over there, state of the art, top of the line stuff. I want to knock down price over there. Because when they started it years ago, it was state of the art, and it's not state of the art now. So, but I want a number. I want a hard number that says here's what it is to replace everything, brand new.
Especially the possibilities for money to take care of.
Well,
Possibility.
hopefully this money that we're going to get from, hopefully we can utilize and get you a new system to where, you're the, I'm gonna say this, but you're the brains of the whole county. I mean, so if you're down over there, nobody is communicating, so.
I'm laughing.
I know. I said I want to,
Yeah,
I didn't know the right word.
I'll start working on that. Like I said, the GIS, we're about ready to bring it down and download it and start training. The other is the Rapid SOS, which is a free system. Our problem with that is, and we're probably another week or so out,
before we'll be 100% complete with that. And the issue with that is if you're an iPhone user, I do not like you. Apple products is the big hang up.
Yeah.
With the last batch of testing, they think they finally resolved it. The issue was that your iPhone was not disconnecting from the Rapid SOS system. So it just sat there and keyed.
Well, again, if I'm not mistaken, it was $250,000 or something that Greg was talking about. And that, I'm sure he's been gone, 2 years. It's probably totally different now. But I want you and, find out what the best system is out there. And, I want to see a hard price. I don't want to see a guesstimate. I want to see something that says, here's what it is if we bought it tomorrow.
Should be getting a quote from the first CAD demo we had. And we have that one tomorrow if you guys want to stop in, starting at 9.
I'll try to stop there because I got a meeting at noon, so.
9 to 5, lunchtime, they are catering Mission Barbecue.
Okay.
So
You guys, you
stop
got
by,
anything, Joe?
stop by and
I'm
take a
gonna
look
try
at
to,
it.
I've got, if I can be there with.
And,
You got anything?
like I said, I've got a video I can send you, and you can check it out. And it's a really nice system. They're both similar. And this company says they can come in under the other one, so we'll see.
Now, what I'm talking about is not a software stuff. I'm talking about.
You're talking about the
I'm
hardware.
talking about the whole shooting
You're
shebang.
talking about the computers
Yep.
and the phone.
Yep. Because I just don't, I picture in my mind and I can't get over the fact that every channel has to have a radio. And that's
Makes no sense.
the most, I can't even say that word here, but,
Oh, I got a dentist appointment at 10 a.m.
that's just crazy that you have a radio for every time you've got to do something, so. Also throw in there about a repeater.
I can tell you, a repeater costs about almost $18,000 for a single channel repeater.
Well, get that too, because
And I can tell you,
I'm radio ignorant, but I know enough to, and actually been educated a little bit to know that if I'm in Lexington, I keep my radio, that goes to the water tower out by Walmart on top of the tower, and then comes back to my radio. There needs to be a better system to where,
if you're lucky.
I know, but that we need a system that where if you're closer to another tower, it's hitting that tower and going. Whatever we have to do, trunking or whatever we have to do to make that happen. If I'm standing on the backside of Hardy Lake, I ought to be able to hit the first tower. It shouldn't have to come to Scottsburg and then come back to me. So whatever that system needs to happen, get a price on it.
Part of that problem is when
Thank you.
they did it, those repeaters would have to be linked by fiber.
Well, the city told me that they would put fiber to the ones they got fiber close to.
I mean, you'd have to link that one out there with the one in Lexington by fiber in order to make it work more efficient.
Well, whatever that cost is, get us a price on that as well.
Or I reached out to the radio people this week because I've been getting a lot of inquiries about why is Washington County system better than ours.
Was it flat?
Well, the big difference is they operate the same system. When they put this one in, when they changed it, 6, 8 years ago, whenever it was, our tower was already up. And Washington County's tower sits on top of the hill and it's a 500-foot tower. And they operate on one repeater for the whole county.
Well, you're right, and those people that are talking to you are telling you the truth, because I can hear a guy on fire department in his personal vehicle talking on his radio, and he's 30 or 40 miles away from us, and I can hear him just as clear as a bell. So,
Back then, when they done that system, I think it was rushed and they didn't do their homework.
yeah. Anyway, get those numbers, because
The
I,
only other option is, they said we could go to a microwave system, like the state police used to use. But I think they found out it was not as good unless it's changed since then.
just get that information and bring it back, because if we get some money, I'd love to be able to upgrade your system over there. Because, you know as well as I do, what you do over is life and death to some people. Could be an officer, could be EMS, could be a fireman or anybody else, so.
The shared lease agreement, the major thing that I have, I just want to ask your permission to go to council to see if I can take money in my budget to put into contractual thing, and then talking to this company for the price of one 24/7 chair. And John has seen my chairs over there. They're rough and beaten up and look chewed up. But for the price of one of those chairs, $1,600 a year, I can get 4 chairs.
Over a period of time. I mean, you pay for it how long?
It's $1,600 a year, I get 4 brand new chairs.
Okay, yeah.
For how many years?
It's either a 3 or a 5-year contract.
But you'd own it.
Well, they come in they take care of all the maintenance, they do all the cleaning on the chairs, and every year they come in and inspect them and switch them out for new ones, or
Is this a one-time payment per year, or is it a
you
monthly
can
installment?
set it up monthly, you can do it. I think they give a 2% discount if you do one lump sum payment.
And I assume they're the best of the best, ergonomics and all that fit in there.
They're 24/7 chairs, they're made to be set in 24 hours a day, 7 days a week. Heavy duty.
But that price is per year for a 3-year contract. And at the end of the third year, if you don't renew it, you get you own the chairs.
I don't know, I've just looked into the pricing and talked to them, but I don't know what happens after that contract ends.
I would assume you'd own it.
I'd hope so.
Yeah, I mean,
I would hope so.
it's a lot more efficient instead of, because those chairs can run anywhere from $1,600 to $3,500, depending on the company.
You getting 4?
And I would get 4 for the price of 1.
Okay.
With all the maintenance and cleaning and inspection.
Yeah.
If the arm breaks off of one, they send it apart, and all the hydraulic system.
The only thing I'm gonna say is, if you have to sign an agreement, make sure it goes through the attorney first to make sure that he's fine with it, but I'm sure it's at this.
I'd like to own them.
Yeah,
I'd like to own them.
Oh, yeah, I don't wanna
Like I
lease
said, I'm
it.
just here to get your permission to go to council to get that.
You're gonna transfer money.
Transfer money into contractual line item,
No, what?
and then I would bring the contract back to you guys.
Had a motion,
Yeah, I make one.
Randy
I'll
makes a
second.
motion, John seconds, I'll make that unanimous, so.
Appreciate it.
That's mine.
That's all the stuff you requested.
All right, thank you.
Did you have a good telecommunications week?
Yeah.
Looked like I was gonna say everybody thought I ate well.
Yeah.
I would like sometime in the future, I don't even know how we do that, maybe I do it but like we could put in a proclamation making a telecommunication.
The governor does it every year.
Departments work for it.
Yeah, the governor does it every year, so.
Well, maybe we need to piggyback on that somehow or other. I'm just telling him that somewhere along the line, maybe we need to pass our own proclamation.
Yeah, I can get you a copy of the governor's. He sends
We
it
can
out.
just adopt right onto it.
Yeah.
I will go talk to him.
Appreciate it.
All right, thanks, Jeff. EMS update. Before you sit down, I heard, you come on, before you sit down, I saw where Clark County or Clarksville had their first baby in the,
Yeah, and I put
in
it
the
on
box.
Facebook, Chase. I'm trying to get it over to ours, I put it on mine. So it's pretty critical to our project. Actually, we're gonna talk about it tomorrow at the ambulance board meeting, what we called, so we can get going on it. I've talked to Teresa to get the funding for that.
What time
Put
is
into
the
that.
meeting?
10 o'clock. and I know you said you're gonna be out. Crosdale can't be there, he's gotta go to his dad's. I think Raymond had a cancer treatment on Tuesday, we're not sure if he can make it. He's been feeling under the weather, so. But, anyways, to let you guys know, we're gonna be talking about the honor board, honor guard tomorrow. So they can go through that. There again, we're gonna be buying that stuff ourselves. It's gonna come out of the county's money. Safe Haven project still, making sure that they're on board with that. We do have the protocols and what the actual end product's gonna look like. So we can go through that. I know Raymond was worried about the protocols and who takes care and the procedures, but all that's in that paperwork. The county's not gonna be responsible for anything. As soon as the baby's put in there, we activate it through Jeff, and it calls 911. I'm not gonna go through the details because it says on there we can't talk about it, so it goes to the ER, CPS is notified, and the state takes over custody of the child, so just let you guys know what's going on with that. Run volume compared to the last 3 years. So 2019, you were at 1466. Last year with COVID, you were at 1299. This year we were at 1095. However, we've turned 455 runs in 1 month. And you know as well as I do, I ain't gonna get into it. But we are having about a 75% increase in psych patients.
In what?
Psychotic. In their routine collars. And you know where one of them is at, east of town. I'm not gonna go into detail about it.
Yep.
We're having more and more of these people are having some issues. Not just with, we're having one issue out by K-Court, and you know what I'm talking about. And it's a repetitive, the same person. And they're finding more and more of the aerosol cans, and they're hiding them. They're hiding them, so just with that, keep that in mind when you guys are talking about the issue. It's just not opioids. So.
Oh, yeah. Well, that actually happened a long time ago and then kind of went away. But there are some still people that do the huffing
and they're stealing, and they're stealing.
My days over there, huffing was not uncommon.
Right. The thing is, they've you know, there for a while, they were breaking into mortuary services and hospitals, getting formaldehyde. Then they were getting into the AC systems and getting Freon.
Yeah.
And now they're going back to the cans.
You could go in the grocery stores and just buy it.
Yeah, you'd get the Ready Whip, or you'd get the aerosol cans for the spray, and they're getting the fuel off the top. Yeah. So we're having an increase in those as well.
Yeah, just curious, what would you think that's happening? Why? Just
I'd
economics?
say probably, I'm sure. But we're having it happen probably once or twice. I mean, it's just like with your guys' discussion tonight. The problem of it is what they're mixing it with. There's not one, whenever we have 4 overdoses in one day, it's because we have somebody else who's cooking. They don't have their particular methodology down right. They're heavy on something. So it's hard to tell what they're heavy on. Is it heavy on the fentanyl? Is it heavy on the carfentanil? Or is it, some people use powdered sugar to cut it with. So it's hard to tell you what the product is because you don't know.
But you get a rash. You get a rash of overdoses, and it happens. You know,
We just
when it
went through
happens
this.
one, you'll get a 3 or 4.
And we just had this.
Yeah.
So it's nothing uncommon. I mean, it's just who's making it cheaper today and how easy they can get a hold of it. So it's just one of those
But
things.
you bringing up that huff and that, gosh, I was 18 years old first time I ever saw a guy do that. I was like, I didn't even realize what he was doing.
Probably, I bet you saw him on the railroad track.
No, he was sitting on
Guy.
a wall.
Okay.
And he had a paper bag, and I'm like, what is he doing? And then when he took it away, I walked past him. He's got gold this way. And I'm
Yeah,
like,
because they're doing it on
And they was
paint
using
cans too.
airplane glue.
Yeah.
Yeah.
I was like,
The problem with that is when they're doing mono glue and that kind of stuff, they get a bag over their head and then they suffocate.
Yeah.
So
That's probably what happened out there when it came forward.
No, actually, she was doing it on the bridge, right there on what is that, York Road?
Yeah.
She was doing it on the bridge. Took 2 cans, fell off the bridge down into the creek, she fell 10 foot.
That's not funny, I just.
You know, it was luckily, it was a warm day, because it had been cold, and there wasn't anybody out there walking around. She was laid down there in the ditch, I mean, she would have found her froze.
Yep.
And that's the worst problem about it. I mean, you guys really can't put camera systems up on the walking trails, but that's something that, you know, maybe we can do in the future, because we're all gonna have that problem.
Well, they used to be, the city police in the summertime, I know they got bikes, and a few of them will ride their bikes,
Right.
you know, in a routine or on a schedule. But yeah, there's an issue there.
And it seems like it's in some real obscure areas.
Yeah.
And I would kind of consider that.
Well, they can do that anywhere too.
Right, but I'm just saying, it seems to be, they're finding some areas it's not very well traveled.
Yep.
So, and it's usually in the afternoon more so than it is in the morning. I mean, because we've been having some overdoses walking down the city streets of Scottsburg, literally out for a morning walk. And people do it, so we've had it. I know James responded with me on one call up here on 3rd Street one morning, because it was a guy just out doing his morning walk. Shot up.
Yeah.
So,
we did the one on the, down Lake Iowa, he was walking
it was middle of the
across.
afternoon.
Yeah.
Still had a needle in his arm.
Yep.
So we are having that problem, you know, it's something that's not gonna go away.
So, no, it's not.
But on the SOR deal, I did call them and talk to them again. We only started billing in 20, and don't give me exact numbers, 2018 you guys did not bill. And you were talking 800 runs. So $75 times 800, you're talking a chunk of change. We've been consecutive at that number. Medicare, Medicaid, and some insurances have been paying. However, with COVID, they have been paying 100%, but that still gives us a lax of about $31,000 a year. Now, when COVID stops and these insurance companies stop paying because of COVID-related stuff, we're going to go through the roof. As it stands over today, we have right around 275 SORs. So I know when I came in here last week saying 125, the minimum, the absolute minimum we can raise so we can bill that is $99.99. So that's something we're gonna have to look at. That's a chunk of change. I think it was like 300, if we included the numbers from the first year, the 2018 year, you're looking at like $300,000. And before that, you're talking a ton of money.
Can you get a,
And I'll have the exact numbers for you.
I'm gonna say, cause
I've been looking at
the
that.
one number I'm looking at is that the people that are paying it,
Right.
I mean, maybe we can do this. If you pay it, maybe we discount it for those people that pay it within so many days.
Right.
And say, okay, it's not $100, it's gonna be 75 for you paying it up front. So those people, and I'm looking at, cause it's, I know it'd be my mother, it'd be elderly people that pay their bills and pay them in a timely manner.
And if you go through that, you'll see that. That's
Yeah.
exactly what it is. It's 100% Medicare, Medicaid, I think Humana, United Life. So I know exactly what insurances companies were paying. But once this COVID thing ends, when the federal government puts a hiatus to it and calls it a day, those people are gonna have to pay that bill themselves.
Yeah.
So what is Medicare and Humana and United?
They're paying 100% of that right now.
100% of what?
$75. That's the ones that they're not paying for, that they're gonna have to get
So
rid
they're
of.
paying for an SOR.
Okay.
So why don't you, some with Mike, I feel like we're punishing those people who pay their bills by raising the rate. So why don't you leave it at 75, if they don't pay 30 days, charge them a $25 collection fee and then send them a collection for $100.
And I've asked that question. And it still comes back with it being less than $100, they can't send us a collection.
We'll charge them $30 to make it $105.
Well, I guess what she's saying, what I'm thinking she's saying is that if it's a $75 fee, you're not gonna send them to collections for 75, but if they don't pay it within a certain amount of time, you charge them a late fee of $25, that makes it $100, and now it can be sent to
And
collections.
I don't think they've done it because I don't think that's how I think they're going back to how you guys, is the actual verbiage of your amendment to what you guys did originally. I've not seen the verbiage on that originally. I just know that she said that was set at $75.
So what you're saying is,
To follow the claim.
but what you're saying is that if we change the verbiage to say it's $75, you got 60 days to pay it. If you don't pay it within 60 days, you get a $25 late fee. Now it can go to collections. So we need to change the verbiage in our agreement.
Your agreements.
So, yeah.
I don't know what the amendment was or what your guys'
Yeah.
what you guys had set up originally.
It's been a long time ago,
Right.
so.
And-
extend that to 90 days?
Huh?
Can we extend that to 90 days?
You can make it whatever you want.
That's up to you guys.
Yeah.
But all I'm saying is we need to look at your original, Tammy would have to dig that up, see what your original, because I don't know exactly where it's at.
Yeah.
I'll be honest with you.
I have a copy of it. I'll have to
'Cause
find
I've
it.
got
You
a book
probably got a
that
copy.
deep of amendments. I don't know exactly where it's gonna be.
Uh,
If I can find it in the minutes.
That's a good
we'll
idea.
need it.
Yes. Yeah, that's a good.
The problem of it is though, we still cannot write, some of those we can't write off. And that's that continues on the report.
Well, you
Is-
should be able to, because when you came last time and you said I
Right.
asked you how many there were,
I
and
said
you're
200.
talking about from the beginning of time.
Well, yeah.
I mean,
but didn't-
every year they ought to drop off. At the end, I think at the end of the year, you ought to clear your books, whether you go into the advisory board and you go, hey, guys, I have 10 $75 charges here. We're never gonna collect these.
Right.
Let's just wipe them off so they're off our records.
So that's not how it's been. And
Well, that needs to happen.
Right, but that's not
You
how.
need to, every year, you need a clean slate. Now granted, it might be a year and 1 month.
Right.
You got to clear
And
the
that might be
slate.
something in your guys' verbiage for your amendment. I don't know how that works.
I'll look that up and see where
Because
that's
a lot of that has to come in with how you guys set that up originally with the ambulance service.
I don't know if there's a bunch of verbiage with that. It was almost like here was the rates and we just approved it.
I just remember the $75 rate
Yeah.
because I've not been able to bill for those type of calls.
Well, it was actually trying to deter some people from continuing to call and never going when they got, and you still have that.
Yeah, that's what the problem of it is like, and I looked at how many we wrote off. We wrote off quite a few, to be honest with you. It was because it was elderly people who could not pay the bill. When they come to me and they call me, and I get that information, because it's not a super huge bill, and we're only talking 5 or 10 a year. We have waived those in the past.
Yeah.
And sometimes we don't even bill those people initially because they can't bill it. They can't pay it. You know,
Well-
grandma's got cat food in the cabinet and she can't afford to eat. We are not gonna charge that.
Well, the issue is, and that's one reason we're a county-owned ambulance service, we have the flexibility to do
Correct.
that. We have taxpayers in the community that pay for that service, and that is a service.
Right.
And if they can't pay, then I don't have a problem ever wiping it off, so.
And that's fine. I mean, that's
But-
what the ambulance oversight committee does when we have the hardship cases and you was there that day.
But what you need to do is that, I didn't realize that when you gave me that number, that was for years.
Well, 2018.
But those need to come off.
Right.
They need to wipe your slate clean and you got zero.
Yeah, we can see how your verbiage, just look at
Okay.
your verbiage.
Yeah, we will.
How that's set up, because I don't wanna do something that your amendments
Yeah.
says we can't.
I don't know if there's a whole bunch of verbiage in that thing. But I'll see if I can find a copy of mine and we'll see if Tammy's got a copy of it too.
So on that order, I know we go one way and go back with the funeral home when you go pick the body up. I haven't talked to all the funeral home directors, but I talked to one today and he's like, yeah, that's okay, charge us the original price. Didn't bother him a bit.
That's between you guys.
Who was that?
I ain't gonna say the meeting, but I can tell you I did.
You can tell me afterwards, cause
I'm not gonna get into that.
No, I haven't talked to all of them.
No, I
But I talked to one today, like, sure,
that's fine, but we still need
And
to
when
stay
you asked
over
me
it.
last week, Mike, it was Kyle that had talked to JD. I did not, so, and that's what he'd said, so, very good conversation with him
Yeah.
was. EMS week, May 16th through the 21st. I want you guys, if you can, Tuesday, 8:30 a.m. on the 18th. We are having the State Fire Marshal's office down, the State EMS Director, and the State Medical Director, Kyle. Somebody's getting a state award.
I'll actually be if it's on the 18th, I'll be out of town.
So you guys are more than welcome.
What time did you say?
8:30. We are also awarding 2 Storks pins, one to Polly and one to Amber out of Lexington Fire Department for their delivery of a baby. Also, the state did away with their Stork program. They started it back. I'm submitting the paperwork for that so that they're going to get recognition. And then Danny and I went in on halves on a project that we're going to provide some stuff for the crews that day.
Which day was this? You gonna have-
May 18th, it's on a
May
Tuesday.
18th, okay.
It's going to be on a Tuesday.
And you said at 8:30 a.m.?
8:30 a.m. I've also included the television stations in Indianapolis and down south to come up here and see if they'll do it. I called the governor's office. He's out, he's busy, he can't make it. So, and I just found out about a week ago. So just let you guys know. Out of state travel, June 2nd and 3rd, I need to go to Knoxville, Tennessee for a class, TECC, trauma, emergency critical care. That's so we can start training our people here to that class. So after that, we'll
You'll have to have, there's a form for that in their county.
I'm so sorry, I was texting Amber, he was asking me.
Out of town education.
Out of county travel, isn't there a form that he has to fill out and bring in here?
No, he just asked permission and we get it down in the minutes.
Okay.
That's all.
So I'm just
Money's
letting you guys
already
know.
budgeted, right? You're not
Well,
asking
the county's gonna pay for gas, I'm paying for the class.
for- Yeah, I mean, okay, that's all budgeted.
Yeah.
Yeah, okay.
Yeah,
You're not
I'm
going-
splitting it.
Yeah, I'm just trying
Yeah,
to
I'm
make sure it's
splitting
not
the
extra
cost.
money. Okay.
I think consensus, you're all right there, yeah.
And then, it's later on in June, we're gonna be doing 2 more days down there for 2 more classes. Then we can start training our people. The primary instructor class is a go from the state. Also, the new EMT class is a go from the state. The advanced EMT class is a go from the state. And we're finishing up the paperwork for the new paramedic program. So we've pretty much tripled what we're gonna be teaching to the staff. Also, the TECC and TCCC classes are gonna be able to be utilized for the sheriff's department for their tactical operations, so they'll be able to do some stuff with that as well. So, just let you guys know.
Sounds good.
See you guys.
Appreciate it,
See ya.
thank you.
Thank you, Shannon.
Resolution to resolution to opt out of opioid settlement. I think all 3 commissioners, were in an executive session and talked about this, so we're just making it public record that we are going to opt out of the opioid settlement that the state's going to receive from this lawsuit. And to explain to people a little bit, as much as I know about it, is that the state's going to receive the settlement from Purdue Pharma to the state attorney, Indiana State Attorney General, and then it's at that point the state attorney general has, and this is by law because they passed a law and added it into the budget law. There was an amendment, I guess, to that law stating that the money comes to him and he's going to distribute it in a fact that he's going to keep 70% of it. 15% of it's going to go to an area where there's going to be programs, and the other 15% is going to go to 92 counties, and it's going to be divided by per capita. So however big your county is, that's how much money you're going to get. So in turn, a little history here, Scott County Commissioners filed a lawsuit, I believe 2 or 3 years ago, on their own against Purdue Pharma.
First mistake.
Pardon
We were
me?
the
Yes,
first
we were the
mistake.
first ones that do that.
since then, and there's not a lot of counties in Indiana that even, I think there's 20 other counties that even filed a lawsuit, and I think all those 20 are together. So what's going on here is we're going to get the short end of the stick. And so our attorneys, and not our county attorney, but our county attorney in conglomeration with our three other attorneys that are fighting this lawsuit, have recommended that we opt out of the state of Indiana's settlement, and we continue our lawsuit, and it will have to be settled before the bankruptcy thing is over with Purdue Pharma. So, and one of our attorneys, actually, he preferred to go to court. He wants a jury trial, and he wants to be in court. And I don't have a problem with that, because we came in with it with zero, and if we leave with zero, then I'd rather go it alone. And so I guess I need a motion from somebody, or
Let me just
conversation.
throw something in there too. We were the first county. I wasn't here. I think you were.
I was here.
But I don't think the state did anything. It was
No,
the
they
group
didn't.
of counties, well,
No.
the group of counties the one filed this.
Yeah, 20 other
And now
counties
the
did.
state's the one's gonna take all
That's
the money.
that's
And dish
exactly.
it out how they want, and the first county that got involved in this
Is
is gonna get in the shaft.
That's exactly
And it
right.
was 70, 15,
15.
So
Yeah.
the figure is, why let them just walk on us? We can get nothing, at least by going on it our own.
That's well, we're gonna benefit, by the PR stuff that the state's gonna do anyway. But as far as monumental money coming to us, we're gonna get the short end of the stick, and God only knows what, nobody knows what the money is that's gonna come to the state. The last time I heard a number was $7 billion, but that's to the whole suit, and other counties and other states are involved in that as well.
Was that million or billion?
Billion.
Billion, okay.
So I don't know
That
how
don't mean
many.
we get
Billion
that.
would be nothing.
But that's 7 billion to everybody, not just the state of Indiana. So God only knows what that's gonna be, but I'd rather go it alone
And be honest with you, as much as I want the money, I'd much rather see some people in jail.
Well,
They literally
I'd rather.
caused, we were talking tonight about opiates. This is who caused it.
Yeah.
The
Well,
number one cause of our problem.
Yeah, they produced a
And they're
drug.
paying us off.
Yeah, they produced a drug that.
Nobody goes to jail.
They produced a drug that they knew.
Opana.
They knew that it was addictive, and they turned their head and did it
They
anyway.
walked away.
Well, something that Dr. Box said that kind of, we're still prescribing too many opioids in Scott County.
Yeah.
And,
That's a big number.
and that's, I mean, we're over the state average by almost 100%. And that's crazy.
Are those numbers public by physician? 'Cause I
She
don't-
will not give you that, and I've asked that 3 years ago, and that's,
They did give them out. I don't know, we got them once. I don't remember.
I've never seen a form with a doctor's name and this is the one, but
I have
I
one
do.
copy.
But I think that's wrong. I think, but anyway, the reason we're opting out, and we're going to hopefully make a motion here and accept this, is that we're opting out to go alone. We're probably gonna reap some benefits from counseling, or not counseling, but PR stuff that the state attorney general put out over opioids, but as far as,
We've earned the right to aggravate anyway.
so.
I agree with you.
I'd rather go to court and watch that guy do his stuff, so
Well, they're gonna pass it out and give us a little bit. We,
might as well get a little bit
I think
somewhere
they're
else.
gonna walk on you, you might as well argue the point.
Well, I argued with,
Do bad by yourself, can't you?
Yeah, that's exactly right.
I actually sent an email, because I don't know if you got that same email, I'm sure you did, but the email from the Indiana Association of Commissioners, where is Mr. Butterworth sent out a thing about the opioid settlement, and I just sent him a quick email back, and it was like 11:30 at night. 15 minutes, he's emailed me back, but it's like, I said, hey, and I pretty much said that. We were the first ones to file a lawsuit. The state of Indiana didn't even do that. And we're going to get the short end of the stick. And I said, I just don't think it's right. So I said, I don't know what we're gonna do, and at that point I didn't. I mean, I
pretty much knew what I wanted to do, but, so anyway, I'll entertain a motion.
I'll make a motion.
And I'll second.
I'll make that absolutely unanimous, so.
I do have a question. The last meeting, somebody, if I remember correctly, there was discussion about another possible lawsuit that was gonna make
Yes.
this one easier to win, and you were gonna decide whether or not you were gonna do that.
We
What's
are
that
doing
about?
that. We are doing that, and I don't even know who we're suing. It's another drug manufacturer. But it's, our attorney said, that this one would be quicker than before this other settlement, this one would be over. So it's something our attorneys in New Orleans and Washington DC suggested us doing, and, said it would, they feel more than comfortable that we were going to win that lawsuit, and that would assist us in the bigger lawsuit with Purdue Pharma, so. All right, moving right along before the, April monthly regular claims considerations. Everybody looked at the claims, and
Yes, I have.
I need a motion.
And I'll second.
I'll make that unanimous. And moving right along, payroll ratification for April 23rd.
I'll make the motion.
I'll make that unanimous. Also, consideration of the April 7th.
I'll make the motion.
All
Pass. Pass.
You get to the signing place back here.
Let's get a second on the
Yes.
minutes. Thank you.
And that was for both dates that we passed that. And, I guess the second part was consideration of the April 7th meeting minutes. And I think John made a motion, Randy seconded, and I make that unanimous. We have a medical leave extension request.
Okay, I have it over here. You guys can look at this, pass it down.
Just sign one place on it.
Yes.
What do you need?
You need
Sign
to look at that. That's a medical
Oh.
extension. It's a,
I think we talked about that, yeah.
it's a post. This is an extension on an extension request.
We usually don't do that, don't.
And our attorney
Correct.
recommended. You go, I'll wait.
I think I know what it is.
And it's, just for information,
It's
it's
FMLA.
information we can't talk about.
It's an FMLA request, which we cannot discuss.
I'll make a motion, pass,
You're gonna extend it or,
extend it.
um,
No, I thought that's what
You
we
need to
wanted.
read
You need to
Let me
read
read it again. I
you need
thought
to
that's what
read
we
the
wanted.
note.
I thought I did read it.
Read the bottom part.
Okay. All right, thank you. Give me up. I will do what my attorney I thought was telling me to do.
So I'll entertain a motion, for or against extending this.
I'll retract my first motion, which I jumped in too quick, and I'll vote to reject this.
I got a motion to deny this request for a third FMLA request. Is that correct?
the initial FMLA has expired. Then, the request was made to extend it an additional 30 days, just an extension of a medical leave.
Yeah.
And, unable to return, and then ask for a second 30-day extension.
Okay. So the motion's made to not extend it.
Second 30 day.
I'll second. Randy's gonna second, and I'll make that unanimous, so, I'm going to mark this as denied. All right, moving along, transfer station operations, what's
up with that?
That was, on your list of things that you
Oh,
were
I
going to
just-
have a presentation for.
Yeah.
Now I kind of got sidetracked.
Yeah, actually, there's not a whole lot on this I know Tim's here and I'm gonna explain what we're talking about. I know last year you brought in a quote of, I think, $170,000 to replace the compactors. That kind of rattled in my brain for quite a while, and with that, went to this mayor and asked him just a ballpark out of the blue, saying, hey, if we closed our transfer station, would you be able to do it, and for what price? So we're still in that money thing, and I really don't have anything to bring to officially say anything yet. I will say, I had an invoice shoved across the desk and showed me that the compactor that we're talking about for $170,000, I think it was for two, wasn't it? We can buy those for $37,500. So it made me kind of think even more what kind of estimate we were getting when, even 40 and 40 is 80. So we're still, a lot away from $170,000. I don't even think that was installed. That was no.
Installed.
It was just equipment only, wasn't it?
I think new compactors and.
The whole shooting match.
I don't have paperwork with me,
Well, I know you work out there, and I'm gonna be one to tell you we're not gonna pull the rug out from underneath you. That's why I kind of wanted a shot across the bow to say we're thinking about this. I haven't even brought the numbers to these guys. So until I get that in concrete and bring it to these other two commissioners and then absorb it and make a decision, I'm only one person, and but like I said, Austin brings their transfer stuff to Scottsburg. There's a rate for them. We could have a similar rate or something different than what they have. So, I mean,
I talked with them and they said that they consider coming back out there.
I didn't hear you. What?
They would consider coming back to the transfer station.
Who would?
Austin, because we have an hour and a half away.
Well, actually, from what I understand, talking with Jason, just actually Tuesday, Monday, he said that Austin's got a key to their facility. So I don't know why they're waiting if they got a key to it to where they can just pull in anytime they want. So
That's what the guy told me, the street supervisor.
yeah, I don't know about that. I'll have to find out, because I was under the impression, as we were talking about the Sunday recycle stuff or Saturday recycle stuff, and how he would dump that because it'd be after hours, and he said, well, he's got a key, so he'd be able to just go in like he does now and dump. So anyway, just, don't think it's happening, tomorrow, but it, I would like to see it happen, because for the fact that I know what the numbers are, or what I think the numbers are going to be, and again, it's not going to, you're not going to be out of a job by any means. So I mean, we're going to take care of Tim. So anyway, any other discussion on that?
No.
Randy, Tim, you got any questions? All right.
I do have one question.
Yeah, go ahead.
Being one person out there, I know you all are kind of tied up with the county health department, but they've always took over.
Covered you for vacations and stuff?
Yeah.
So you got a vacation coming up?
It's either I'm gonna be calling John or you.
We're gonna have, I think, actually received information today. I think Kevin's gonna be on board on the 24th. But he's gonna be new to that system. Do you have time coming up pretty soon that you're gonna be off for?
I got that covered, man.
Usually you'll call Steve from out here.
I got that covered.
And Steve comes
I'm
right
not
in.
sure.
Steve, look these up.
I feel comfortable you having John do it.
What he said?
He said he'd be comfortable you doing it.
Yeah, I don't care. Call me.
The line would be backed up there. You can call me, but my number's changed actually.
I got it.
It's 6588, so, anyway, that's, just let us know if whatever's going on, so anyway, that's what's going on with that. It was just kind of a, we're just kind of, or I'm just kind of thinking what we can do instead of paying $170,000 for 2 compactors that I think is, and I find out now it's an outrageous price when you can buy them for $37,000.
I got a couple other quotes that rebuilt, and then I got another quote of a cheaper brand, but it's not really that much cheaper.
Yeah. Well, I'll have to find, I mean, I actually might have took a picture of the invoice because I wanted to know what the company name was. Because I was shocked, I mean, to say the least, so. Anyway.
Same size?
Yeah, it's exactly the same.
Exactly the same?
It's,
Same thing.
I don't know if it's the same brand, I mean, but well, let me ask you this. What's the city, do you know what the city has over there right now?
Yeah, from Marathon 575.
So what, I mean, what kind of size is that? Is that bigger than ours, smaller than ours?
Compacted, 6-yard compacted.
It's exactly the one that they have over there because they're gonna buy another one. And, they gave me the price of what they were paying for it, so anyway.
Okay.
All right, well, last thing on here is the county attorney position. And Marty, I saw where you applied.
We're voting on
Yeah.
it.
She's a legal mind.
Yeah, she does.
I wouldn't have went there. I guess, anybody got a preference or want to talk about it or got somebody or what?
I don't care. I can go first, Randy can, or everyone do it.
Go ahead.
Yeah, well, go ahead, Randy, go ahead.
Everybody knows I would like to see Joe do it, but, you know.
And
Sure, thank you, sorry.
I can tell you where I'm leaning, just over to Raleigh Campbell right across the street. But, you know, we'll just go where we gotta go.
Well, I'm gonna throw a wrench in the thing.
Here we go.
Choose either one of those, right?
I sat in on a meeting that, it was a council meeting, and they had an attorney there that had applied for the county, or the county council's position. The guy's name is Zach Stewart. He lives in Hennerville, and, I was pretty impressed with him. I know that there's local attorneys here. I'm not gonna question their experience or whatever, but I don't know how many of them have that experience in city or county government, or if they're all just, defense attorneys in a trial or whatever, but that's where I'm at, so you got one, I got one, and Randy's got one, so.
And I got several reasons to pick them up. One is just right across the street, he's local. And same thing with Joe, by the way, not across the street, but he's local. And,
Doesn't it make sense though, that an attorney serving you guys who's actually not in this county would have less of a, yeah, what's the official word I'm looking for?
Connection?
Conflict of interest.
Well, I hope they have an interest.
Well, I mean, as far as
Couldn't be
giving
swayed.
unbiased legal counsel, that's
Yeah.
all. I just have always thought, since y'all started talking about this, that somebody not in the county would be a better idea.
I can just give you my opinion, and we go where we want with it, and you have a good point.
Well,
I
that-
like it because he's across the street, so I get a hold of him, I know him.
Well, the one,
And it's close by, and I know that job's gonna carry somewhere between $50,000-$100,000 a year. And I'd rather keep that money local.
it's gonna what now?
I'd rather keep the money,
How much you said?
I'm bet you I can't give you an exact figure, but I'll bet you it'll be somewhere between 50 and 100,000. Not just salary, by the time you add all the work that goes along with that.
That's not what we pay Bob.
The contract that we have now is $2,025, or $2,025, I think, per month, for the services you have now. And then there is over and above that get billed beyond that.
Yeah.
But I would have to go pull the numbers to see, but
It's considerable
It could
amount of
be.
money.
you know, it does depend, also.
But if it's only, I'm sorry, go ahead.
But not knowing exactly.
Yeah,
And
that's
then
money,
the
that's money, when it's
yeah.
gone, it's gone out of our county.
Well,
And you can add another 6 if this council attorney ends up being, yeah,
If
council
we
spent
share,
6
yeah.
a year on theirs.
Yeah, they may not want
So,
that.
I'm gonna say this, we need to have an attorney.
Yep.
I mean, we have a lot of stuff out here on the table that we need to start knocking down, and we can't do it without. So I'm gonna go ahead and make the motion, to go with, Zach, I guess.
And I vote no.
it's Zach's Stewart.
Stewart, yeah.
And I do know that he gave his, what he does now, and that's kind of the law he's into, but, and he's familiar with Scott County. I mean, he's grew up in Henryville, and I'll be honest, I don't know a whole lot about him outside of what he sat there and talked about. I've talked to some people that do know him. So the other part of this is, what are we in, May? We've got to the end of the year, it's a year-to-year contract. If something doesn't work out with anybody, we can say, you know what, let's readdress it and let's go a different way. And I don't have a problem doing that whatsoever, because we're in a dilemma that we've never been in. We've always had, 40 years of one attorney. We've never been in this situation. So attorneys, I struggle with attorneys because I don't like them.
Well, he comes to all our meetings and all that. What do you think? I assume he's talking, he'll be at all our meetings,
Yeah, I think he would be. That's what I'd require. If he can't meet those requirements, then I'd say he can't fill the position.
And there's actually some other things I want to bring up. I wish I had it written down. Some issues we've got going on we need addressed.
Well, what we can do is and of course the attorney's a little bit different than a highway superintendent, an EMS director, or whatever. We could have maybe an executive session, bring him in, sit down and say, hey, here's what we are asking for, and if it doesn't
Does he
jive.
have a price? I don't know what he would consider commensurate for his services, or what, he might.
He may
since you
say
guys
no.
have talked to- Yeah, he might say no. I don't wanna do that.
I've had that happen in the last
And
year.
we
A
haven't
lot.
And we haven't heard a definitive answer from council if they wanna piggyback on your all's attorney.
So
So,
you made a motion, I'll second that motion since that's the one that I made. John votes no, but let's send a letter to him. Let's invite him to an executive session where it's closed doors, and we'll have Bob Houston there as well. And Bob can ask him some questions and.
That's okay, but that's kind of like putting the cart before the horse.
Well, you gotta make
Questions after the heart.
an offer to him.
would you
Cause
want to discuss the
what's your
situation
thoughts?
executive? Is that your motion?
I
To,
think so.
to bring Zach in for, an
Yeah.
interview basically in an executive session? Is that what you want to
Is
do?
that something you do in executive
You
session?
can,
Okay.
yes, because it's perspective and your attorney can be an executive session.
Let's do it this, let's pick an executive date and do what we did at the highway, and as soon as it's over, we'll have a 15-minute meeting or whatever and vote.
Okay.
And
So
we-
hold off on the vote tonight, or not?
You okay with that?
Yeah, okay, I wanna fast
We
track
need
it.
it, we said we were gonna do it in May, and
And I know I'm sitting there trying to throw a monkey wrench, this don't mean.
No.
But shouldn't we give Raleigh and Joe the same opportunity? Or are we just considering one person?
I think in the very beginning, we talked about that we were not going to interview attorneys, and I don't think what this executive thing is really about now is not necessarily, an interview. It's pretty much, here's what we expect, are you able to do this? It's almost like an acceptance letter, but I'd rather be talking to somebody face to face and have him say, I can't do that, or I can do that, or at the end of it, I'm not interested.
Yeah.
Who's talking?
Hi. Did we ask for bids on these attorneys? In the
No.
application?
We haven't had an attorney problem in 40 years.
1980
Right.
or something, yeah.
Have
that's
we
the-
known for 4 months? So, would it not have been reasonable, we asked for a bid on contracts all the time?
We pay a certain amount to our attorney. If he doesn't agree to that, then that's on him. So, it's not gonna be, he's gonna walk in and give us a price. He's either gonna agree to what we're paying, or, just like we do with the highway. We gave him a price, here's what you're gonna make, and if he doesn't like it, then he doesn't accept the job.
I like where you're going with that, but.
And I get warm call
For me,
letters to regional attorneys all over the place asking for interest in the council and commissioner attorney positions. I got very few responses.
Yeah.
And
That's what I'm asking.
yes, yes.
Yeah,
And so- And also in statute, that there's 2 instances that the commissioners can actually determine all of this on their own. And one of them is their county attorney. They don't even have to ask council what they spend on their attorney. And the other thing is the highway engineer stipend of $40,000. They have that under their control, and they have their county attorney, their commissioner board's attorney under their control totally. If they, they could set their salary they wanted to pay their attorney, and council could not walk on that. So it's
Well-
totally up to them, so it's really not a contractor, it's their negotiation with who they're gonna have represent them. Yeah.
That's what I'm asking.
So let's,
That's a good question, yeah.
Let's pick a date, and I'm gonna be honest, guys, I'm leaving Monday, and I won't be back till right before the meeting on our next meeting, so I'm gonna be out of town, so anytime after the 19th, I'm good.
Okay. Could we do it on the 19th?
Yeah, I'm good on the 19th.
That might be, we have a meeting that night.
We got a meeting that night, yeah.
I mean, if we wait after that, then we'd be.
I'd rather
a couple more
well,
weeks.
let's do that.
Yeah.
Let's see if he can come in earlier on the
You want
19th.
a 4 o'clock? Can you do a 4
Randy, can you
o'clock
do a
on the
4?
19th?
Yeah.
Sure.
We know how those executive sessions go. Yeah, I'm gonna start 3:30.
We get somebody one way or the other way,
Yep.
somebody on board.
Yep.
So let's
Make
do
it at least
executive.
3:36, huh?
Let's see, I'll contact Zach, see if he can be here at 4 o'clock for an executive on the 19th.
All
How's
right.
that? Is that your motion?
Yep.
Get a hold of Zach,
Yep.
get him here on the 19th.
Yep.
Okay. For my consensus,
And I'm not gonna ask.
4 o'clock. Meeting on executive, 19th.
I know we usually ask if anybody's got anything,
Are
but
we done?
I don't have anything. Randy, you got anything?
No.
Oh, sure. John, you got anything? Okay, all right.
Hell no.
I need a,
You got it.
motion, Randy motions.
I second it twice.
I'm gonna make that unanimous, and I'm glad this is over.
And I would like to compliment you actually